I didn't either. We need one more board number. Wait, oh, that's Dahlia. 1, 2, 3. Okay, we actually have 7, so we can get started. Teresa, you want to go ahead?
Yes.
Okay, thank you.
Good afternoon. We want to share with you a few highlights from our caring culture. We already shared some very late on Thursday night, so we aren't going to repeat any information. I just want to thank the principals that are here today that have waited, and we asked them to be here in case you had any specific questions about anything. As you can see, it's been a collaborative approach between Human Resources, Office of Professional Learning and Family Engagement, Department of Special Services, and Office of Communication. I just want to thank everybody. As I shared last week, we structured our presentation around 3 buckets of information: students, community, and staff. The narrative report, if you haven't had a chance to look at it, is organized around the metrics with an introductory explanation of the action, key findings, analysis, and next steps. In addition, in the back of the narrative report, you'll find an appendix section, which includes additional information and highlights several of the special education initiatives and programs from this past year. Special ed, if you recall, the special ed information for academics was actually in the Goal 1 presentation and the Goal 1 report. And with that, I'm going to hand it over to Kathleen Waltz to share some information about a video.
So the Caring Culture Report includes some pieces on family engagement, as well as our cultural proficiency work. I do want to recognize some parent liaisons that have joined us at the work session today. Thank you for being here. And also staff representatives, Renee LaHuffman-Jackson from Family and School Partnerships, and Nina Thomas, our Professional Learning and Cultural Responsiveness Coordinator. So wanted to share with you an update on our work with cultural proficiency, and we have a video for you to view, which will provide an overview of the professional development that we've provided over the last year with staff that has been engaged in a cohort model in which teams from schools participate in 3 to 4 days of professional development to ensure their learning is deepened beyond a one-time professional development experience. In this video, you will hear voices from school-based administrators as well as teachers about the impact of this professional development on their practice.
Hello, I am Nina Thomas, the Coordinator for Professional Learning and Cultural Responsiveness of Fairfax County Public Schools. FCPS is committed to demonstrating cultural competency and sensitivity when supporting students, families, and employees. The Cultural Responsiveness and Equity team is responsible for the professional development of all Fairfax County personnel to create a climate that fosters and sustains dynamic relationships between students, staff, and the community. Our goal is to model and promote equitable access and opportunity for every student's academic success. Some examples of our work include supporting FCPS leaders in broadening their lens for equitable leadership, the training of school-based and central office equity leads to foster a culturally responsive environment, and providing professional learning opportunities for school cohorts to deepen knowledge around cultural proficiency and equity. This equity cohort is a 4-day program. School staff members participate in extensive professional development, including hands-on activities, dialogue, reflection, and school planning, in order to develop their personal cultural proficiency, as well as share the guiding principles of cultural proficiency with others at their schools. I'm excited to show you an example of the learning that takes place in our school-based equity cohort.
What questions come to mind as you look at this picture, and what assumptions are you making? Have a conversation at your table really quick about what you're noticing.
I'm wondering, like, was this intentional? Did kids choose?
I think as a principal, I'm really excited to see so many participants, so many teachers who were willing to come. I really do see that the work of cultural proficiency is so important and also unique to our school system, in that we are really making efforts to understand all journeys. And I'm excited to see the influence that this particular cohort is going to have on my teachers and then into the building.
I think the biggest thing that helps us, by being together as a school is really just having these honest and open dialogues. These conversations that you have during the cohort aren't necessarily things that you're going to have eating lunch. They're not necessarily things that you're going to have after school. And so coming here as a staff, we're able to have these kind of conversations about how we're going to develop culture in our school and, move towards cultural proficiency.
I feel like cultural proficiency has really lit a passion in me. It feels personal. I have found this wonderfully challenging in a good way, to stop and take a look at myself as a child. I think I was a student that was looked over because I seemed fine. But it's a wake-up call for me, because I have to think, if I was missed, who am I missing?
I realize that there's more that needs to be done in order to really address our different families coming from different backgrounds. It can be very challenging to have a school where there is 60 different nationalities represented in any year. And how do you actually address those needs?
And we haven't had training like this. And it's so needed to allow kids to flourish and allow students to succeed, because without that level of comfort, kids are not going to feel comfortable to grow and learn.
I know at my school we are diverse, and I think that this gives me even more tools to relate to my students and to be a better teacher to them.
Even if we think that we have our hearts or minds in the right places, it gives us a different point of view. It makes us look at our students in such a different way, things that we don't know, things that we need to start discovering and looking into our students to make the everyday education in the county better for them.
And now I look at other people around me and I think, what is their story? How did they come here? What difficulties might they have had in their life that I didn't? Or how is my story different or similar for them? So now I feel like I have a better understanding of other people's stories and journeys.
I would say my biggest takeaway with the cohort is just being aware of my own thoughts and beliefs, and then also that safety piece of having other colleagues that you work with and knowing that you're all together and that they might feel a certain way, you might feel a certain way, but having those conversations.
Challenging your own thinking, I think, is what I've walked away with the most. Kind of examining my own thought processes and getting into that spiral. Okay, well, why did I think that? Or why was that my immediate reaction to that? And then how is that going to impact my students? That gut reaction I had to something, how will that impact how I teach or how I work with a student?
And I think it's just an amazing experience. Whether you feel you need it or not, you'll definitely learn something or get something out of it, and that could help you as an educator.
So I'm sure all of you followed Mr. Moon's direction and did a lot of reading this weekend. So with that, we're going to go ahead and move into questions.
Okay, we have 2 hours allotted for this portion of the work session. And sorry that I missed the very beginning part of that's a video clip. That anybody has any questions or comments or any suggestions to make? Oh, wow.
Well, I mean, before we go into board discussion, I guess I'm just being a little bit mindful that I appreciate the fact that we do need 2 hours for all of us to be discussing it, but there are people in the public who weren't there for our Thursday night walk through the slides. And it's a little concerning to me that we're having a work session and we're not going to look at anything that is framing out what this next 2-hour discussion is going to be. So I guess I would have still liked the teeing up of, Dr. Brabrand's unfortunately not here. This is one of our goal reports. So, you stepped out just as I threw a comment to you.
Anywhere.
No, but I mean, this is.
So, Mrs. McCullough, again, I'm sorry that I missed very beginning part, so I don't know what transpired.
All we saw was a video, and it's concerning to me that this is a very important goal 2 report, and I would like, even if it's just Dr. Brabrand, but someone should be saying, so of this massive report, here's the biggest things that we as staff are letting you know from our annual analysis of this report.
Your points are very well taken. Again, because I missed the very beginning part, I thought that already took place pretty quickly. And I thought, wow, they did a good job doing that. I had to take a call from someone. Yeah, so if you could spend.
So if you could go ahead and put the 1-pager up. There we go. As we shared when we met last week, this original discipline data is just a snapshot that reflects the number of discipline entries that have been put into our student information system. And I believe I shared with you on Thursday night that these would include students that would have been referred to the hearings office. Some of the highlights and the big points are bulleted beneath that particular slide right there, that over the last 4 years, there's been a decline in the overall number of violations. Disruptive behavior, which would include tardies, defiance, disrespect, that declined most significantly at the high school level. And keeping in mind that disruptive behavior is actually the largest number of entries in SIS at all levels. At the elementary and the middle school level, there was a slight decline in the student information system entries overall, but an increase was seen in disruptive and aggressive conflicts. Of some concern, weapons violations have increased at all 3 levels. Many of these weapon violations did not require a referral to the superintendent because most likely those knives were under 3 inches. But this does suggest that we need to do a deeper look into why students might feel the need to bring a weapon to school. Are they feeling less safe at school or feeling less safe on the way home? And as I shared also, after multiple years of decline, there was a rise in out-of-school suspensions. And as per the school board directive, we will be doing further analysis of our discipline, not just at the hearings office level, but also in student information system referrals overall. And we'll be reporting out on that in the fall to you. So youth survey, moving over to the right side, and I want to keep in the student bucket for a minute there. I reported on those metrics that were there. Some of the good news about students feeling sad and hopeless and having suicidal ideation are actually at their lowest rates since 2011. And alcohol and tobacco marijuana use is the lowest in 5 years. Not to read the rest of the slide up there, but just something to keep in mind that I would like to share with you that there is a new tool associated with the youth survey where you can actually do correlations of questions in the youth survey, and that gives some pretty detailed information about not causation, but correlation. So it is something that you can look at. Some of that information shared with us, for example, that significant numbers of youth that do continue to report high levels of stress, but it does correlate with spending 3 or more hours doing homework, spending 5 or more hours using an electronic device, not including schoolwork, and experiencing depressive symptoms and getting less than 6 hours of sleep. I do want to draw your attention in the report where we indicated there's information about assets because we find that this is important and something that we really want to delve into for the next year. The data indicates that increasing assets is the most effective way to reduce risk behavior across a wide spectrum of issues, including bullying, use of drugs, carrying a weapon, and involvement in activity. And if you don't know what assets are, they are protective factors that promote well-being in students and youth, and also enhances a youth's ability to resist risk and make good decisions. There are 3 domains for that which include home, school, and community, and that is significant for us because we are going to work with our county partners to really identify how in each area that we could gather additional information and delve into what most powerful ones would be so that we can report out and work with schools with that from our end. Moving on to the community bucket, if you would scroll up a little, sorry, I'm going a little bit backwards here. I listed some of the highlights of the great community partnerships that we have right now with many of our school partners. The Children's Behavioral Health Blueprint, we continue to implement initiatives that are coming out of that particular relationship. Those members include county agencies, nonprofits, George Mason University, and the schools. And these initiatives are around coordinated prevention efforts that increase access to mental health for students, and especially those with limited income or additional barriers. We currently have been working with the Short-Term Behavioral Health Project, which it will be expanding to selected schools. And this is really providing counseling for students, and primarily for those with high rates of poverty and high rates of depressive symptoms on the youth survey. Next year, the county is implementing with our partnership Give an Hour, and it's a new program that's going to be started in 1819 and provide ongoing treatment by private providers for youth survey as counselors and school staff. Provide referrals, and it will be an hour private providers assisting and giving up their time pro bono to help support us. So Opportunity Neighborhoods, Dr. Panarelli has been extremely involved in Opportunity Neighborhoods, which is currently in Mount Vernon and the Reston areas, and will be expanding to the Herndon and the Bailey's Colmer area. We're very excited about this. This initiative really provides support for communities as a whole, and helping reduce barriers and providing supports to the community. It takes a two-generation approach, working with the families as well as the students, and focuses on community, family relationships, connecting youth with adults, caring adults in their life, how to help support literacy, transportation, navigating medical, a variety of supports and services. And lastly, as I shared with you last week, we talked about the opioid and the gang prevention task force, which we are very involved in, and we thank our support from the communications office. Hopefully you've seen some of the blurbs out there about opioid and opioid prevention already. The Board of Supervisors funded 6 substance abuse specialists for Fairfax County. These specialists will begin working in 5 pyramids. These pyramids were selected based on 3 years of youth survey discipline as well as our AOD seminar data. Dr. Panarelli worked with school individuals as well as county individuals and the county epidemiologist in order for us to identify which pyramids will be receiving that support. And the Gang Prevention Task Force, as I mentioned, they have provided additional funding for our parent liaisons, so we appreciate that.
So then if we move to staff, the video that you just saw illustrates the cultural proficiency professional development that has been provided over the past year. Again, the purpose is to learn the content deeply and have staff apply the content to their practice, and then to help to build capacity in other staff members at their schools. So this has been very successful, and we look forward to the upcoming school year where we will have equity leads in every school, office, and department, and we will have 5 equity and cultural responsiveness specialists to help to move the PD forward and ensure that all schools have access to participate in that PD. Just like to mention a couple of pieces from family and school partnerships that are in the report, but I just know that they stand out and wanted to be sure that you are aware. We do appreciate the school board support for our parent liaison program and the continuation of contracts for our parent liaisons into the 18-19 school year. So this year we've had 35, and we're moving to another 28 contracted parent liaison positions. So we thank you for that, as well as the many other programs that we operate in family and school partnerships. One that I wanted to be sure that you were aware of, because it was a discussion at another school board meeting around the FCPS program, our preschool program. and some data around how we serve children off of the wait list for FCPS. We served over the last school year 190 children in our HIPPY program that were on the FCPS wait list. So we do carefully use that list as we engage families in early literacy as well as HIPPY programs. Thank you.
I just wanted to add some other efforts to support staff with Goal 2 in the caring culture. One of the things we've been doing is measuring the level of staff engagement through our employee engagement survey. We've now conducted the survey for the past 3 years, the first year establishing some baseline data in terms of where our strengths and areas for improvement lie. And we're happy to see the positive trend with that survey over the past 3 years in terms of our highly engaged percentage overall trending up over that past 3-year period when you see the green bar and blue bars there in the graph. Other efforts we have ongoing out of HR to support caring culture is our employee and award recognition efforts. We had our FCPS honor event last night. Through those efforts with site level, pyramid, and region level winners, we've recognized over 550 employees in the organization. Another piece that we've started with partnership with the foundation is our FCPS Cares program and recognizing an outstanding cares every month, one from each region and one from central office. And with the support of the foundation, we've been able to collaborate on celebrations out at the work sites, and we've been managed to have celebrations across 52 work sites for those individuals in the organization.
So some additional programming that we've been able to provide under this particular goal report centers around wellness programming for staff. And we've had a couple of new initiatives that we've brought out over the course of the last year. One being a new teacher resiliency program, which has had some really great effects for people who are joining us transitioning out of college and into schools, but also as career switchers. And so we've gotten some really great feedback about that resiliency program. We also have a Healthy Back program that's being piloted in our transportation area, and that's in conjunction with some workers' comp claim information and some partnership with our EAP program. And that's going to have some stats and results available to us in September and into October. We also have been partnering with Virginia Heart and have a stress and heart disease focus where we've had a couple of different video streaming opportunities to give people information about healthy heart habits and how to embed them in their lives. It also is supported by the EAP and Virginia Heart, as I said, but the EAP actually brings it around, and we have programming available via online and phone services for people to have consultancy around the results of those heart programs and some of the things that we can do relative to biometric screening for employees. In addition to which, we launched the Ola Ala, which is a Hawaiian-themed fitness program this spring. We had a great result relative to employee engagement, and there were just over 2,400 participants with 213 sites competing with 247 teams. We also did our routine flu immunizations. This past year, we had great engagement. There was almost 10,000 folks that got flu shots, which means there was reduced absenteeism and increased levels of engagement where people are not thinking about feeling like they have a temperature, but they're actually teaching the kids. So both from a presenteeism and an absenteeism, that gives us a lot of great results. We also had a large increase in worksite programming for fitness classes. We have some really great options available to folks, not only for those who win programs like the Ola Ala team competitions, but also we have a list of programs that the fitness liaisons that the folks for policy, I think it's 2100 that was recently enacted, can utilize and bring fitness classes to our staffs in after-school programming or before-school programming. We also made some changes to the health plans in the past year. We've gotten a strong message around communications and how to provide some clarity around the health programming and what's available. We've brought the utilization for emergency room access down, which is great because urgent care facilities can certainly take care of a good portion of claims dollars that could be avoided. So that's been a very successful program this year. We also continue to do the implementation of a multi-care disciplinary team with all of our health vendors to help support folks who are moving along their wellness path, if you will. For those of us who are around the table that are aging, I certainly can attest to the fact that that's been a very successful program. Lots of information that is centered around very personal decision-making for folks in their health path. We also have some strategic communication enhancements that we've done over the course of time for our leave programming, as well as our health plans. Are we going to show a slide?
Yeah, sure we are.
Yeah, that's what I figured. So I'm waiting for Chase to cue up a slide for me.
Finish.
Oh, okay. And we've also transitioned some of our leave programming over to regionally based supports, so folks can, so folks can establish routine and contacts so that they can have clearer communications. There we go.
Good bad.
And also strengthened our ADAA accommodation support enhancements there in the programming.
No, just a little bit to end our caring culture. Of course, we see two of our future bright and shining future FCPS students there sporting their onesies because of our Mothers-to-Be program that we have. I may be a lot partial to the one on the left, just for those that are keeping score. But yes, that is Charlie London there. And then Damien, one of our other team members' sons on the right. But another example of one of the great programs we do, and it really does exemplify what we do in caring culture. These are some of the great things we're doing to support employees, to make their work environment a place they want to be, not just a place they have to come to support our students. And our team, all the team around the table is doing this every day for both our students and our staff. That really concludes the information we have for Goal 2. There is a second slide deck about the engagement survey, which is embedded in this, but is also separate because we didn't have an opportunity to have that presentation earlier in the spring. Once we get through Goal 2, I will circle back and make some additional comments to summarize the engagement study work. But with that, we are open to questions for the Goal 2 report.
Okay, I have a couple of board members on my list, Mrs. Church and Mrs. McLaughlin. Anybody else to put on? Keith Camara, Evans, Strauss, Pelchik. Anybody else? Okay, let's see whether we can do this. In the first round, let's put up about 5 minutes for each person, and then we'll go to second round until we are done.
Can we go to the
Mrs. Church.
Can we go to the discipline stat slide? So the start of my question is, and if you all recall, when Principal Eline and Principal Thomas were here at our previous board meeting, one of the things that we were talking about was it wasn't necessarily statistic driven, but it was about the climate of what's happening in the classrooms. And I recall the conversation about the use of cell phones in the classroom and how that's really changed education. And one of my questions is, because we see an overall decline, and there's actually a magnitude factor if you understand that in the same amount of time, we have more students. So as a percentage of the students, it's even a greater shift in terms of what has happened. But you said that, that the statistics are down on like things like, disobedience or I forget how we phrase it. But my question is that does that really necessarily take into account the pulse of the culture of the classroom in the view of administrators and teachers in the building that don't get elevated to an actual discipline statistic?
So it's different at different levels. So certainly at the high school level, they do report that there is less mean behavior at each other in the classroom, disruptive behavior, disrespectful behavior to peers as well as to adults in the classroom. We are seeing more of that kind of behavior with the younger children. and we're not exactly sure what it's entirely reflective of, but we are seeing more. So amongst the types of things that are getting recorded in the discipline group, so this number is just purely what's entered, right?
Right.
But as you
but
go
see, that
further
seems
through
to
the
fly in the
report-
face of what I heard from Principal Eli and Principal Thomas at the last work session, which was actually that there's a little bit of a despair of teachers in the classroom with sort of that like an increased, almost like a little bit of a defiance conduct of students, like make me. That it doesn't necessarily rise to the level of a disciplinary, but what it does is it alters the culture in the classroom in terms of undercutting the authority of a teacher. And I don't know.
Okay, they're pointing to someone in the back. Oh, there's Matt.
Hello, everyone. One of the things I would say to you is I think the SOSA has really made a difference at the high school level, and that working with kids and also working with teachers, and when there is perhaps an issue in a classroom, having the SOSA come in and sometimes just observe what the problem is and being that person that's a little bit neutral as a visitor to the classroom is able to help facilitate some of the problems that might occur with students and teachers. So I think the SOSA has really paid off in that way. And perhaps, I don't know, perhaps that is why you're seeing some of the statistics go down at the high school level. I can't speak really to the elementary level why it's going up.
Okay. And then that's interesting. I don't know if that's something that we want to delve a little bit further into, because the culture of the classroom really does not only dictate the success of the students in the classroom, but it also dictates the well-being of our staff. And the feeling that, and anecdotally, some of what I hear is that there is a frustration of the discipline, not the serious discipline, but sort of this, that teachers maybe sometimes don't feel respected by students. And then it gets into the push me pull you of what's happening at home and how do you have conversations about that. And that's that really does make up part of our, that's the longevity of teachers and holding on to good teachers. And it's the overall climate of success in a building. So that's part one. The other part is that, can we go to the part that the bigger screen that had the overview with the notes to the right? Yeah, the one pager. Yes, thank you. I'm going to tell you, and I got a little emotional about this at the last work session. The level of stress in students, yes, this is the one on the right-hand side, basically 36% of our youth. And what's interesting is juxtaposing that to the bottom bullet, which is basically 62% are getting 7 or more hours of sleep. That is great news. Now, what I would love to know is that in comparison, because I have a feeling that's up. I mean, I don't know, but God gave me a brain, He's expecting me to use it, and I imagine that's an uptick with our change in start times. Yet, more than 1/3, not just stress, high levels of stress. Stress is bad. It is particularly bad in young people. That, what that does to, the ability of the brain to be able to make wise decisions, like when it's a stressful culture in the classroom or something. All of this pays off. And the question is, what's the underlying reason for more than 1/3 of our students reporting high levels of stress? And this is where I said at the last work session, something is gravely wrong. We should not be in a situation where 1/3 of young children who are minors are reporting high levels of stress. And if it's homework, if there's a causality to that, which, you get to teachers who say, well, it's an AP or an IB class, and that's a college level class, so they get 2 hours of homework a night. Multiply that times multiple classes. We're out of whack. And I think this is one of the underpinnings, whether it's violence in schools or bullying or culture in the classroom. We're walking the cat back slowly to get to the epicenter of what the problem is. We're a couple squares away from really what's the issue? What is causing these high levels of stress? And I think if it takes a directive from the board to the superintendent, we have to figure this out. This has to do with grades, competition in Fairfax that's unique in the water. It has to do with college admissions, all of it. But the 36% is a problem.
One thing that was interesting, and it does come up in the report, is that we did not find a correlation between, so we found a correlation between getting 6 or less hours of sleep and high stress. We found a correlation between getting 6 and less hours of sleep and higher rates of depression, and that they also did more screen time. So some of the time that they were not sleeping, they were on screens. We did not find a correlation between getting less sleep and high grades. So the kids are asked to evaluate, it's a self-report, but they're, are your grades mostly A's and B's, like that. We did not find a correlation with grades, which we sort of thought we would, because the feeling is that it is in response to trying to do very well academically that people
they're
are feeling a lot of
sacrificing their
stress.
sleep to get high grades.
But we didn't find that correlation. They weren't, where we found it correlated with the stress was correlated with a number of things. We did not find stress correlated with higher grades.
So you didn't find a correlation between reporting less sleep and higher grades or more sleep and higher grades? There was no correlation.
There was not a correlation between sleep and higher grades.
Okay, so that's actually a good thing. So we can tell kids you can get more sleep and still get high grades if there isn't a correlation. That's
again,
actually
their report. Yes.
That's on self-reported. That's good news. But we have to do something about the stress.
And I think, again, we have been looking into the whole stress matter in terms of trying to both figure out what it is, but also how to help kids cope. And there is new research about sort of how one perceives stress, whether one perceives stress to be very bad for you, perceives stress as sometimes having benefits for you. Clearly high levels of stress are not great for anybody. Moderate levels, low levels of stress, in fact, have positives. So some of what we hope to do in the next year is communicate some of that information out to the kids and to parents so that there is not always a one-to-one association in people's mind that stress is something to be avoided at all costs.
I think that is a perfect part of the ultimate, is he still here? Mr. Guilfoyle's, communication strategy, overall communication strategy and enhancing communications. And it's true that stress is a motivator and that's a good thing, but always to be in fight or flight, which frankly, more than a third are reporting. And, this conversation that I'm still trying to get us to have with, some national experts, what this is it's more evidence for us that there's opportunities for us to do some pretty significant stuff and be a leader in this regard.
I would just share very, very briefly. Our foot is on the pedal here, folks. If you think this staff the last year has been sitting around, ask them. So we're moving. It's just how quick to move. We got to keep peeling this back. I forget, Marianne, is this broken down on the youth survey, do they break down by ethnic group to report the stress?
Can certainly get that, yes.
Part of what we have to do with this is the messaging. One, messaging to the kids about the supports we have in place in schools. By the way, with your support in the budget, we're going to have 18 more positions. We've got to let kids know who the social worker and psychologist is in the school. We've got to figure out how we destigmatize access to talking to those people, that's a positive thing. And we've got to spend more time messaging with our parents. And I've got to be honest, it's probably going to be different messaging to different parents based on the needs of their child. It's not going to be a one-size-fits-all message. I think that's going to help us. Some parents need to take it back a notch, and some need to continue to push their kids. So we've got to really differentiate our message better, and I don't think we've done it. I will say this, as a parent, not even as a superintendent, the biggest negative my own children see in the system is the relentless amount of stress that they see their peers on. And where is this coming from, Dad? So they don't feel it from the house, at least overtly. Maybe I'm sure there's something about being the child of someone who's in education.
I would agree with you that my student town halls would mirror that it's all, it's not completely, but a lot of it is peer-to-peer driven. You
Right.
said you broke it down by ethnic groups. Did you also break it down by if they were special education? Because I will tell you, the kids who are special education are academically and socially frustrated.
Right.
We don't have a question on the youth survey that asks whether you are in special education or not, so we can't divide it that way.
But let me say a few more things, and we're not there yet. We're kind of jumping, but it's good you're pushing us in questions. We've been looking at employee engagement, student engagement. We may want to start to shift and deepen to look at employee culture, school culture and climate. The state debated whether to go with the climate, and that's a whole nother thing for principals. They've been getting climate surveys from us and culture surveys from the state. The state looked at doing that and then chose chronic absenteeism instead for ESSA. I believe that's correct, right, Francisco? So we need to peel it back more, and we're going to, and I think it's going to need to be nuanced, just like we talked about calendar or some other issues. Different kids need to hear different messages. I thought I had another point I really wanted to say, and it'll come to me later, and when it is, I'll share it. But marketing more to our kids who have needs to know that we're here to help. Oh, I remember what I was going to say. The parent summit we had this fall, and then the all-county principals meeting, the gentleman, John, what was his last name? Dalton. He said in this region and in several metropolitan areas in the country, we have a culture called the cult of competitive suffering. How can I outdo? And this peer dynamic, I want to aspire to suffer or be more stressed, and that brings some sort of value to saying, I'm really stressed, oh my God. That, we've got to take that apart and say that as we do healthy life choices, which you're going to see our revised strategic plan soon. So we started it today, and we'll have it in front of the board. We're really going to have to double down on messaging what healthy life choices look like, and that this kind of culture isn't a healthy life choice, whoever you are.
So if I have a next step, my next step out of this is how we work, board in conjunction with the superintendent to determine what our next go-to out of this is to address that. The my uncle is deader than yours, mentality is something that we have to break free from. So
thank you, Mrs. Schurz. Mrs. McLaughlin, no pressure on you. Try to do in 5 minutes.
Yeah, exactly. No, I appreciate it. What I really liked, Mr. Moon, is you said, we'll go first round 5 minutes, and we'll have second rounds till we're done.
Mrs. Schurz took 15 minutes, so
Yes.
she's not going to get second round.
Yes. Well, no, that's the challenge of this whole thing. All right, actually, I'm going to start first with what Dr. Brabrand said, because I think it speaks to a lot of what's up here. I don't know who John Dalton was. I'll go Google him and read about him. And I don't necessarily disagree with him, having had 3 children come through this school system who performed extremely well and are going to extremely competitive universities, the best we've got. But I got to tell you, I'm going to say it again, this isn't about kids who can't make healthy life choices, because one just graduated Georgetown and one's a year away from graduating UVA. Neither one has been even remotely as stressed out as they were coming through FCPS. Their time at the best universities in the country, they have not been stressed out in the classroom, and they're Dean's List kids. Okay, what I am going to reiterate, since we're here on the caring culture, and I don't know how this even gets captured, when we are telling our teachers and our students that we want 1 graded assessment per week, and each quarter is 9 weeks, So a semester, if you make the equivalent to a college course, is 18 graded assessments per class. These kids are taking 5 academic subjects, just like they would in college. That equates to 90 graded assessments in a semester. Not a single one of us around this table who even went to graduate school had 90 assessments in a semester. And that's being generous. So I will say that before we try to assign that, oh, it's, just the fact that we live in a metropolitan area, it's not that. It's the direction that we've given our teachers and we've given our students. And if you talk to the teachers, they will say they're stressed out, because I just gave you those numbers and they're having 120 to 150 kids. And you do the numbers of 18 graded assessments towards 120 kids. Somebody run that on their calculator right now. I mean, we've got stressed out teachers and stressed out kids. And when are we going to start doing some of those numbers and that data analysis? Because otherwise we'll never get to bringing down that number that more than 1/3 of our kids are registering as high levels of stress. And just for the record, Dr. Brabrand, right before you arrived, we used to tell our teachers 2 graded assessments a week. And thank God Karen Garza and Steve Lockard and Noel Klemenko, we all started pushing on how about we just tell them we'd like to see 1 per week? But we need to even, so I'm on my soapbox and I'm sorry, but having just had my youngest graduate, I mean, it's bittersweet to have your kids graduate and move on, but I'm also looking forward to him experiencing what his brothers did, which is a lower stress level. And it wasn't because my kids made bad life choices. That in terms of the report itself, I really, for the GLOWs, appreciate that there was a greater effort to do findings and analysis. A GROW would be that I will send you a message to read later on, but some of this is not findings and analysis. It's just a summary point. We still need to do a little more work on, I think, we've got the metrics here. So I'm really pleased about that, and that's another GLOW. But how we're actually analyzing it, we're not quite there. I will repeat something that Ms. Schultz says a lot, and I know I say a lot. In here is way too much a percentage without the numbers. And that's percentages without context. So I can't, whether it's the discipline statistics, which was, the ones that kind of caught my eye the most, but it's really hard. And then for some unusual reason, a lot of the numbers, it was like giving us by the month and then over multiple years. But then I can't even see what's the raw numbers each year to see the growth or reductions. So I just think there's some things that would help for having the information all in one spot. But a GLOW again is thank you for everyone, the team, trying to, let's say, rather than just here's a data chart and there you go, there's a lot more here. I would like to call out everybody's attention in case you didn't see it, because it's a subject that's near and dear to my heart. Page 36 of the Youth Suicide Review Team that was created in 2015. There's a link here to the full report in case people didn't see it. And that in reviewing the 23 cases of death by suicide, there are staff that the team has made some recommendations. And I think that's important because we have the public that keeps coming to us and saying, what are we doing as a county? What are we doing as a school division? And so I think that was good. But I do also want to point out on the prior page 37 that when we were talking about the prevalences of feeling sad and hopeless, it was saying, that 25.9% feeling sad and hopeless, suicide ideation at 13.7% are at their lowest rate in 2011 as a key finding. But again, I have no context for what that would be. So it would be helpful to say that they've come down from this percentage and that percentage and then some numbers so that we can put that in there. I think, Mr. Moon, I'm sure I went over my first 5, so I'll just ask for a go back.
Okay, thank you, thank you. Ms. Kiss-Gamera?
Okay, I'll start where Ms. Schultz and Ms. McLaughlin brought us in, Dr. Brabrand. We were talking about this correlation between, there being no correlation between sleep and higher grades. And I'm going to beat the drum that you know I love to beat, and that is with respect to making sure that our communities understand that our parents understand that, because I'm not sure where the stress is coming from. I suspect that parents can be a part of it, kids can be a part of it, but that has to be a part of our messaging, which brings me to my second point, which is we really have to tailor our messaging, which you mentioned. And so I would, if I have a next step, and I'm not sure what you said, Ms. Schultz, so this may be repetitive, I just don't recall. But really looking at how we can get this particular information out to parents and how best to tailor it to the various communities. Because as I look through this information, I am concerned about how effectively we are communicating with different groups. When I looked at the numbers for certain languages and their use of our website, it goes down dramatically. And so we really have to be much more creative in terms of how we do that. I'll just piggyback onto our meeting last week with respect to FLE. What I brought out of that board meeting was that there are communities we now need to go back to make sure, A, they actually understand the facts, because there was a lot of misinformation there, but also how we can best make them feel as though they truly are having a meaningful participation in the whole process. And you seem, I'll be quiet for a second, and don't count this against me, because he wanted to say.
I would just say, I think you heard Mr. Gifford earlier, we're going to relook at our entire communication strategy, and I think how we market the messaging may be different for different kids. We differentiate instruction for good instruction is differentiated instruction. Good communication is differentiated communication. And different communities have, traditionally we've done well at communicating with certain segments of our community in Fairfax, other groups not. And I would say one other piece that I'm getting to see, or at least my anecdotal, so I don't have data yet, but once you make a personal connection through a parent liaison, a principal, a superintendent, you can get access to them, or they can get access to our network of tools. But no one's going to use those tools if they don't have trust in where it's coming from or respect for where it's coming from. So we've got to do a better job at making those cultural connections across our communities that are very diverse, something I've talked with you about, Mr. Moon, and in year 2, year 1 was visiting just region by region approach. I really want to get out to communities that have been under-messaged and bring them a team to see, here's what we have, and here's how you can better communicate with us, and here's how we can better listen to you. So look for some of that in the coming year, and that's part of where I think you're going to, Ms. Schultz, both of you actually, about next steps from caring culture. Mm-hmm. I also think you're going to see a sharper strategic plan with metrics and strategies for the caring culture that we're really going to put our thumb on and make sure everyone in our school system knows we're tracking.
Okay, so as I read through this, I had a lot of comments, so I may not be able to mention them all, but one, I thank you for the information. To me, I look at this and I say, okay, this just tells me where we need to do so much more work. But I know that you guys have already done a lot. I want to start, I have page 42. There was comments about bullying and numbers with respect to bullying. Our bullying numbers being down, but with respect to negative comments about race and culture actually being up. And I'm kind of confused because in my mind, I can't separate those two, but they seem to be different categories in terms of how we're looking at them, right? I would not think if one is making negative comments about another person's culture that would fall outside of bullying. So obviously I would want to develop a plan on how we're going to address that, because I think that comes into also some of the increased numbers that you cited with respect to discipline. And so certainly my long-range hope would be able to reconcile some of those numbers and making sure that we're looking at them in the way that everybody else looks at them. Maybe it's, the way that we've divided the information. I don't know if you want to comment on that or not.
I can do two comments. There is, both in the SRNR and at the state level, a very specific definition of bullying.
Mm-hmm.
And in FCPS, we have not separated exactly, but we differentiate between bullying and forms of harassment. So sexual harassment, mm-hmm. harassment based on sex, harassment based on race, etc. So we keep numbers separately on those two things. And sometimes the children will report that someone will make one comment about their race or religion, which is inappropriate and mean, but would not meet the definition for bullying, which needs to be repeated, serious, a differential, in power. There's very distinct definitions for those. On the youth survey, we just say, here's the definition of bullying. How much has that happened to you at school? When have you been the person doing the bullying? When have you been the recipient of that bullying? And then we ask a separate question specifically about race and religion, which is why the reported thing is from the youth survey, where the kids are reporting very different numbers. Actually, bullying itself is down very significantly with that acknowledgement that the definition of bullying includes those things that are repeated, intended to harm, and are done with this differential in power. The wording of the question on race and religion is a little softer, if it will. Has somebody teased me or said something bad about race or religion? And that's why you see that differential. We used to have we used to ask the question about bullying a little differently and ask sort of, have you been teased or bullied? Mm-hmm. And we got higher numbers there. Now that the question is asked more specifically to the definition that's in the SRNR, both the number dropped automatically when we did the definition, and then it's gone down in the 3 years since we started using the new definition. I think the more troubling difference to me is not that they are not the same number, but that the race and religion has gone up every year. While we've seen a decline in cyberbullying, we've seen a decline in regular bullying, we've seen a decline in a lot of things, but that, and I think that it's somewhat reflective of our current environment.
Absolutely. And I agree with you, working toward a solution, and I believe the numbers are also up with respect to mistreatment of others. And all of those things would be tied together. So I would be looking for ways that we can come up with a plan, first of all, to understand where these incidents are occurring. Is there a epicenter, so to speak? Is it occurring within certain schools, certain regions, and that sort, to the extent that we can identify, so that then we can have a better idea as to how to respond. You wanted to say something?
Yeah, I'd like Nina Thomas to comment on that because she's been doing extensive work in our schools.
So I just want to point out that this is the very reason that the work that myself and my team are doing in Fairfax, and it is directly related to the idea of bullying on, all aspects, race, religion, and beyond. And I think that our work with Marianne and Teresa's office working together is vital when it comes to this type of data that we're getting from students in our schools. And also the idea that having this equity lead person within a school to support the idea of being reactive, because that's what we are mostly, is reactive to these issues, but being proactive. And that's being more deeply embedded in the work of being culturally proficient, culturally responsive, and equity. So we're all doing this perfect dance in order to be proactive in all of this, to say this is what we're doing, and we will without a doubt see the effects of the work within, maybe 3 years. We will start to see a shift in the culture of our schools, in the culture of FCPS. And I'm back here sitting and I'm listening, everything that you've said, everything from when we started. I think we came in on the calendar. All of it is related to this work. It is all related to this work, understanding and respecting who people are and the needs that they have. It is all directly related to cultural proficiency. So in FCPS, we are on the right track, but we want to get away from having to be so reactive, to being proactive in all of this and being deeply embedded. And ideally, what does that look like? It looks like when our students are starting to lead this work. That's when we will see some ahas. So I'm glad we're having this conversation, and I expect that my office will be working closely with DSS.
I appreciate that, and my next question was going to be what steps are we taking, if any, to raise up those leaders? We have such a wonderful student representative, and all throughout my year, I have just sensed the greatness in so many of our kids, and really, I believe if we can give them a platform in this area, we would see great change. So, my hope is to hear about exactly what it is you're able to do and how you're able to disaggregate some of these numbers, where you're targeting, and how we can support you from where we sit over here. So I thank you. I thank you for your work. I'm trying to wrap it up. Don't count, but she said again.
It's been more than 10 minutes.
I know. One thing, I do want to get to restorative justice. There were a lot of good numbers in here about that. And, the fact of the matter is, when it's implemented, it works. My concern has always been, to what extent is it being implemented? And is it something that's being supported from the top to the bottom, from the hearings office to the teachers who are dealing with this? And are we implementing things like behavior intervention plans and recognizing where the children are emotionally? And, we see the appeals, but we don't see what has been done to kind of help bring that child back in line with where they need to be. And so those are some of the things that I'm concerned about, and would love to see those particular numbers, where restorative justice has most been implemented. Those kids who have gone through this diversion program, I'd like to see broken down numbers of that, and how we plan to expand that program, because we know that this works. We know that we can put kids on the right path. And I just think we need to focus more on that. And I'll be quiet before Mr. Moon throws something at me. Thank you.
Thank you. I have a Ms. Evans to be followed by Mrs. Strauss, Ms. Patrick, and Ms. Delana Colfax.
Thank you, first of all, for this excellent report. And I tell you, Mr. Moon, you might as well put me on go back right now, because I'm going to be more than 5 minutes. But
all right, thank you.
I'm going to start with sleep, since that's certainly an important and favorite topic of mine. We have some good news here. It's not as we're not there yet in terms of where our teen students are in getting enough sleep. They really should be getting about 9 hours of sleep a night for optimal health. To go back to Ms. Schultz's comment, I do see that we're talking about overall they're getting this much, but that's 8 through 12. And so I did go back to the Youth Risk Survey, and from 14 to 15, Ms. Schultz, there is a difference. All of my colleagues, there's definitely a significant difference in the increase in sleep with our 10th and 12th graders, where we went to later start times, and our 8th graders, where the amount of sleep declined. From between the time in the year of the change, 10th grade went from looking at 8 hours or more, 22.6% to 28.4%. That was a significant improvement. 12th grade was 14.4% getting 8 hours or more to 17.2%. So that was a significant increase. At the same time, though, the 8th graders declined from 53.4% to 50%. So we have pretty clear evidence there that going to the earlier times for our middle schoolers, did not help them. So I do think we need to revisit our middle school start times. 7:30 is not ideal for those adolescents either. So I'm glad to see that our high school students are getting more sleep, although, again, we can do better. I also, I believe, aside from the academic side, that with the 3 to Succeed, I wonder if it isn't time for us to include sleep in there, because I believe when we have correlated amount of sleep and risky behaviors that there's a direct correlation there as well. Isn't that the case?
We are working with the county right now on revising the 3 to Succeed messaging, and part of that process is we actually have the same epidemiologist who helped us with the work that we were doing on which schools to pick for the SAPs, is doing a complete analysis of the youth survey to see where correlations might exist that we had not looked at previously. So we're waiting to get the information back from him before going forward, but sleep is one of the things he's looking at.
That would be great, because I believe there have been occasions where we have individuals have cross-referenced kind of on their own. They've used that great data, and they have seen the more sleep, the fewer, alcohol use, drug use, sexual behavior, that sort of thing. So I think I'm delighted to hear that we're doing that correlation, because I think that will prove to be significant. I'm going to go back to something Ms. McLaughlin mentioned, and I regret that I was one of the few work sessions that I've missed on my time on the board was when we discussed the healthy life choices. And when the strategic plan comes back to us for final review, I do want to revisit that, because I feel strongly that we need to change back with what we're measuring there, to suggest that it's all about students making healthy life choices. We bear the responsibility for our start times. We bear the responsibility for how much recess time we give kids. We bear the responsibility for what we serve in the school cafeteria. We bear the responsibility on workload. So I think that I just want to give everybody a heads up. I am going to ask that we revisit that, and I'll have an amendment on that when the time comes to look at the strategic plan. Because I can't see us backtracking, and to my mind, the new language backtracks. Great news on that suicidal ideation is down. Of course, 1% is too high, but, I'm glad to see we're dealing with that. But I agree with my colleagues who have said that we need to deal with stress. It's clear we need to deal with stress and workload and our students feeling overwhelmed. So I look forward to continuing that as a huge area of discussion. And before I give up the floor, I'm going to just ask 2 questions, and then I'll need to go back. On the trauma-informed care, very glad to see that in there. I've had a constituent come to me to talk about something called Handle with Care, and I don't know if my colleagues are aware of this, that it's, as I understand, and correct me if I'm wrong, if something has happened to a child in their home where the police were called, there was a traumatic experience, that, I guess privacy issues have kept the police from being able to say, this happened to this child or this happened in this child's home. But they can say to a school, just handle this kid with care tomorrow, because something has happened that you need to know about. So rather than a student simply coming in, putting their head on the desk, and the teacher thinking, oh, they're, just zoned out, or they're, not feeling well or something, that they know that there was a trauma. Have we considered dealing with Handle with Care?
We are exploring it. We're looking at other areas of the country where they are doing it, and we have started a conversation with the police department. Mm-hmm. Again, because we're so large and there's so many schools, and there's, it is not always easy for the police to make a quick, it's an extra step. It would be an extra step for the officers. So we've started the conversation because it's dependent on their workforce doing the work. We feel like we have
connecting
to,
with us or with the principal. How does that?
well, again, you'd have to work out an entire protocol that would work within Fairfax County. So in a very small, place in West Virginia where theirs is working very effectively, everybody knows everybody, and so they just know that they're either at this elementary school, this middle school, or this high school. In our case, we would have to have some way of people, probably WeCare or something, some way of people being able to connect a kid with a school. And then most likely at the middle and high school level, the information would go to the DSS, who would then funnel to teachers. At the elementary school, we would have to figure something out. So anyhow, it was brought to my attention. We did start a conversation. I just said it was going to take us a little bit of time to work out all of the logistics and see whether people were on board with doing it. I didn't feel like I could commit the police department to do something that would be a workload issue for their officers.
Well, I'm very glad you're having that conversation because, all of us can think of times when we've known of families where a child has either been attacked, had a sexual assault, and their school may not know why that student is out for the day or out for the week and needs something more than just, being told, oh, why were you absent? So I hope we can work that out. I'll ask one more question with Mr. Moon's indulgence. With the resource fairs, it looks like we had some successful ones. How many do we have coming up this summer? Do we have resource fairs planned?
So we'll have 4, the same locations where they were last year.
So it's Stewart, Lee, South Lakes, and Mount Vernon?
Yes.
Okay. And you have dates for those?
Yes.
Okay, great. Thank you so much.
Okay, thank you, Ms. Evans. That was about all the time you needed to have for this work session. Mrs. Strauss.
How many minutes, Mr.
In the larger document, on page 20, sort of in that area, and we brought it up before, the increase in the mistreatment of others at the elementary level, aggressive and disruptive behavior at the elementary level. That is concerning. I know in the new strategic plan there's more stuff we're going to do, but what can you comment on that? I know a couple other people have raised that. Where are we going?
I think that there are probably a couple different things contributing. I don't know whether we have an elementary principal here. We do have an elementary principal, so maybe if you want to go to the mic so that you can follow up. But one of the things is that we have more children at the elementary level who don't speak English as their first language, who have come often with some exposure to trauma. Right. And so some of what we have been dealing with has simply been scared kids who can't quite figure out what's being expected, but their response has been, think about a 2-year-old temper tantrum and put it in the body of a 9 or a 10-year-old. It's sort of explosive, if you will, within the school environment. And so that people are like understanding, but still trying to figure out a way to keep everyone safe and to make sure that the child is getting the interventions that they need. So it isn't necessarily even that those behaviors are always getting a terrible disciplinary response, although in some cases it's necessary, or we have found it necessary. We haven't found another way to do it. We suspend the kid for a day or two while we get our plan together, right? And what the plan will be. So that would be my first thing, but I would go with...
Yeah, I would say, hi, Maureen Marshall, principal at Stratford Landing. I would say we have a lot more children that are just developmentally inappropriate. So looking at those tantrums, I say the kindergartners are not the kindergartners of yesterday. They come with a lot more trauma, there's just a lot more issues going on with them, and so very much to what you said, they'll throw things, they'll kick, similar to a 2-year-old tantrum, and some it's their first times in school, some they just don't know what the expectations are, but it's very different, and then gathering exactly what they need, working with the family, and figuring out how to put things in place for them. But I think as you look at the elementary numbers, though, I always say we get a handle on them pretty well, but you're doing a lot more child development things that would be done in preschool prior to.
And I think on a national level, we are seeing, the research continues to show that just all children, most children, are not developing the same self-regulation skills prior to coming to school that children used to. Now, one can argue whether they haven't had enough play, they haven't had, they've been on machines too much, they have not had sort of social interactions where you learn to work things out. But for whatever reason, we certainly find that we are sort of teaching social skills that we used to anticipate that kids came with.
And then how does this fare, certainly our advocacy for quality early childhood and Head Start and all those programs?
I can't speak to that, but I can say for many of these children, the word no, it's the very first time that they've heard no. And so thinking about, you can't play with this right now, you need to line up. Schools are very different than what parents have seen at home. So even if they've had the child, 5 years, they've done what the child has asked them to do. This is the first time they have to actually adhere to rules. And so it's very different.
And does this pretty much show up with children who have not been to a quality early childhood, or it's...
We're seeing it across the board.
Oh my, that's upsetting, to say the least. All right, so have you come up with a plan other than working harder, smarter to
Why we all look very
researching
tired right now.
Researching it. Come on. There is an unusual, that's really troubling. Are we seeing the same thing in early childhood programs?
I would assume that, I don't know. I know that we are seeing it in our own preschool programs,
Sure.
although our preschool programs tend to be special ed, they're very low numbers.
Right, and that's a different...
And for some
right,
kids, even if they've been to a nice quality, good quality preschool program, just going to the larger number into a kindergarten is difficult. But certainly kids who come with no preschool experience are worse off typically.
Right, one would
I think
expect
we can certainly say that. But even in our very affluent schools, we are seeing an increase in an expectation that the environment will change for them and not that they will align with a certain environment.
And I would say, even when you look at first grade, so kindergarten, you have the two adults in the classroom, you switch over to first grade, you have one adult, 27, 28 children.
I would also like to add that in our HIPPY and early literacy programs, we work with both the families and the children. And I think it makes a big difference because not only are the children learning the expectations, but the parents are as well. And so it sets them up for success for kindergarten.
But again, what I'm hearing from you say, this is not necessarily exclusive to children who've experienced unusual trauma, children in Head Start Title I.
No, I wouldn't group it by poverty either.
That's what I'm saying, not group it, because you would...
So you have also children that are being raised by nannies and au pairs, and there's a lot of other parenting issues that are occurring.
We need to sign the parents up. Okay. It's very upsetting. I should say it's concerning.
I do think that, and this goes back even to Mrs. Schultz's question about the culture in the classroom or the culture in the school, we are finding an increased need for direct instruction about social emotional skills. We have just recently partnered with UVA and with Yale to do a very extensive 60-school research study at the elementary level.
Good.
With bringing in, and those programs, the Yale programs, start, the first year is all teacher focused. So how does the teacher want to feel social emotionally in the environment with their peers as teachers? There's a lot of teacher resiliency building, and then you start working with the children. So we have great hopes for that program. Again, we're part of a research study with them now.
We've done so much work with positive behavior initiative. We've done so much of that really in the last 5 to 10 years. So you're seeing
It's just focused at a more emotional level. So whereas with the PBIS, we say, what are the rules and expectations? Here's how you do those rules and expectations. With Ruler, it is more of a how do we want to feel? We want to feel respected, valued, loved. What do we have to do in our school to be sure that we feel that way?
But PBIS is still a good strategy.
Absolutely,
Okay.
absolutely,
All right,
and
right. So all
they
of those tools
interface
we've
very,
used.
very, very closely.
Okay, all right. The other unusual chart is on page 26, growth in the number of incidents referred to FCPS AAP. You have an August far there of 2017, what happened in August? A whole bunch of kids in one school that did something and we diverted them.
No, so the AAP program includes things that happen in the community.
Right, exactly.
And we are finding that the most common thing is shoplifting in terms of it being an appropriate restorative justice sort of response. So when it happens in the community, the most common thing that the police are referring for is shoplifting. So I don't know whether August and coming back to school has something to do with that.
This is October. Huge.
Well, and this past year in October was when the police force went to universally across the police force using it. So some of it is a training issue
thank you.
that everybody went ahead and started using it at once.
Okay, great. All right, and then the other question that I have, Dr. Brabrand, did you have something?
I just want to say something about your worry on the early childhood. It is an issue in every school division in Virginia and the country. This is not a Fairfax County issue. I know it doesn't help to hear, oh my God, it's a lot worse elsewhere, but that's the truth. One thing we've got to do more of is we've got to reconnect with some, we've got to connect with some groups. We've got to message with some groups that haven't gotten the message. But we need to reconnect with what parenthood looks like today in 2018 and meet those parents where they are. And many parents, in my experience in the division I was at for a while, if the partnership and trust is there, they want to learn good best practices to help their children. We ran a special needs center, and one of the most popular things were play groups. Getting a chance to interact with other children and then be around other adults, including other parents, but then other educational professionals to observe behavior and help shape it. So I don't know how much we're doing it here yet, but we're going to have to take things like that to a higher scale and let parents know we want to work with them. And I think there's a chance for us to connect at a much larger audience and share best practices that maybe we've just taken for granted are just going to be there just 'cause.
I would just
Kathleen?
like to say that we offer a whole host of programs for parents and families, facilitated playgroups being one of those. Renee, do you want to add a couple more just to paint a complete picture of the family engagement opportunities that we have?
With the playgroups, we're working with Opportunity Neighborhoods, and currently we have playgroups at Bailey's, Lower, and Hutchinson. And we're doing a lot of our playgroups through the trauma lens. So that's the support that we're doing.
Very much appreciate what you're doing in Hutchinson. It's very
So-
successful. My last question are the drug counselors. So that's being funded by the Board of Supervisors because we've had them before and then we didn't do them. And now they want them to come back. And will kids actually go see the drug? I mean, how? Because that was, we had the evaluation of this use in our high schools was mixed.
We did a study of it before we made the proposal. Where we saw the breakdown was not in kids seeking them out and talking to them, but in the follow-up when there was a recommendation that they should be in some form of treatment for their drug problem. And one of the barriers appeared to be that the previous model, the counselors were CSB people, and as employees of CSB, they were under a particular form of confidentiality restriction, which did not allow the counselor to talk to the child's parent if the child was over 14 and said no, or 14 or older and said no, or talk to anyone else in the school about their concern about this child. Because CSB is a treatment provider, therefore they have to follow that set. So part of the rationale for making them school system employees is that we are then operating under school system rules, so that sharing the information with a parent, being able to work with the parent liaison if the parent needs an additional message, being able to work with a school social worker, et cetera. So the biggest thing that we are looking at in terms of measuring success of this new program is how many kids who are recommended for treatment actually complete treatment, because before it was a very small number. So the CSB has gotten some additional positions to take kids more quickly when we make the referral. And there are a lot of other things that we're doing through the AOD seminar, et cetera. But we're hopeful that by having them be school system employees, we can address some of the issues
Okay,
that
so
occur.
I'm pleased to hear it's a different model because the last one was not successful. So is the funding coming from us or is it coming from
It's
the
coming
Board
from the Board of Supervisors. It's a dedicated funding stream from the Board of Supervisors for this purpose.
Great.
It also includes another person who will be a school system employee who will supervise them because we needed a level of expertise around drugs that no one in my office had. Again, that puts them on our evaluation system, and so it is just a little easier versus having an external evaluator of people who are doing things in the school.
Okay, very good. So are they in the schools now or this begins in the fall?
Begins in the fall.
Great, okay.
Hopefully.
Thank you for changing the model. Good.
Okay, thank you. I have 3 more board members on the first round. As a Ms. Pelchick to be followed by Mr. Colfax and Mr. Wilson.
Thank you. I will try to be brief. I just want to thank you, Dr. Brabrand. I 100% agree with what you're saying about building those relationships. And I think we can have all the information in the world and we can have the experts, and we do. But as I saw in international development, it took a week to build that relationship and to have people trust you and be able to connect them to those resources, as opposed to years of not building those relationships. So I assume that's a continued work, and I know we have excellent partners, and perhaps looking at how we continue to expand that, because I think we have a really important work. I want to know how we're going to communicate the assets to our kids, to our parents, to our community leaders. I know we've had some of these conversations. If even we know a little bit about it and not much, how is the community, and I agree, how are the kids starting to share this with each other? I was so proud my niece ran for office, didn't win sadly, but made it through her primary, and her number one issue was bully-free schools in elementary schools. And so how do we really help support our students and our parents to take ownership and take this on and move it forward? So I hope we can continue to work together on that. Beyond that, the programs, I have been a huge proponent, thank you, Kathleen, of our early literacy and family literacy. I know we have Micheline over at Grand Road and even does a middle school parent leadership program. And we have so many great programs at Jackson and other schools. So, and I know those are very, cost effective compared to some of our other pre-K programs. So I guess that's something I also want to ask. I'm happy to sit down and figure out how we, in the lack of having the comprehensive pre-K programming for our students who need it, where can we expand and where do we see the greatest need to really target families, parents earlier on, especially if we're seeing that there really is that need to communicate that. So that's something I hope we continue to expand upon. The big one, and coming back to it often, is the SOSAs and our middle schools. And I know we have some, Matt is gone, but Martin's here.
Looks like Hayfield will be getting another SOSA.
Well,
you win the.
Well, and the reason I wanted to ask Matt is because I think what I'm asking is at the middle school level, right? They've worked so well in the high schools. As far as I know, we don't currently, personally, as a board, fund them at the middle school. And I know we've had conversations about responsive classroom at the middle school. So what are we seeing really that we could expand down to middle school and maybe even 5th and 6th grade that has worked so well at the high school level?
So I think at the SNR presentation, I said, so my SOSA spends about 60% of her time in the middle school. That actually is where she spends most of it. I think I said my 8th and 9th grade is about 85% of my discipline is in the 8th and 9th grade level. So she spends a lot of time with my 9th graders and she spends a lot of time with our 8th graders. Our in-school and out-of-school suspension numbers have gone down significantly over the last 3 years. Excuse me. So I think what the SOSA does so effectively is, one, they do get a hold and have that relationship with their high flyers. And because they're not giving discipline, they're trusted by our kids. And so they also, I think it's very important that you get the right person in the job and that you use them in the right way as well. So my person, she's actually licensed to do clinical work, clinical counseling in Washington, D.C. So she does a lot of relationship building. She does a lot of conflict resolution. I think conflict resolution, kids cannot positively do effective conflict resolution on a large basis. There's lots of kids that can, I shouldn't say. I don't want to make it seem like, oh my goodness. But there's a lot of things that happen on social media, or they happen, and then when they meet up face to face, the ability to talk through it and talk it out. A lot of girls groups. I see a huge. Listen, our fights used to be boys. 10 years ago, our fights used to be boys. Our fights are girls. I would say, and without looking at my dad, more than half my fights were girl fights. And so it's really. But what that SOSA does is that SOSA is able to work with those kids and those high flyers. The other thing is that as they're working, and I've heard a lot about, how our teachers react and whatnot. The other thing that they do very, very well is as they're working with a teacher on working with a student, they're also retraining the teacher on how to work with other students. So that, that strategy on de-escalating and not engaging with Johnny also works with Sally in the next class. And so what we have found is we've actually had a lot of teachers who, before they'll even go and do a referral, and I think this was a question about referrals versus atmosphere, before they even go to a referral, they'll go to the SOSA first. But again, that's a relationship that SOSA has established with the teacher, because again, that SOSA doesn't evaluate the teacher. And anytime you're in an evaluative relationship with somebody, it changes the relationship. As great as your relationship can be, it changes it. So I hope Dr. Brabrand doesn't get too mad at me, but I think middle school SOSAs are an absolute necessity.
Thank you. So I don't know if that can be a next step, or if really, I know we've been talking about this for a while, but I would love to see a plan on how we want to be proactive at the middle school level with training around, behavior management, whether it's a SOSA, whether we start with larger schools middle schools we're seeing the greatest need. I would love to, for next year, see that we have a plan for that. So I don't know what that will require. Training staff, a 3 to 5 year plan, whatever it will. I would love to see that. And I also want to echo the first grade comment. I actually heard this from a retired teacher who's been subbing in our schools, is done because she said, we really need more support in the first grade. She felt that classrooms of 25, 27 students where you're seeing very high needs, and where in kindergarten there's that additional adult support in the classroom, is feeling that in first grade it just becomes very, very challenging to not have that. So I don't know if that's something we've looked at, or I know it's a budgetary issue for the IA, if there are other recommendations or targeted supports for that. And I don't know if second grade we're also seeing that, but I know K and 1 are just, still early childhood level. So I know it's very challenging work. I really appreciate all of the information, and definitely we want to continue support where we are seeing those gaps, and especially where we're seeing the rise in some incidents.
One of the things that we are hoping with the additional clinical support at the middle school level is it would provide an opportunity for the staff there to do evidence-based groups that work on things that often are the underpinnings about why the kids are responding the way that they are. So we'll be tracking and seeing whether we see any benefit from that as well.
Thank you, Ms. Parachek. You're great. Mr. Narcofax. That's a setup for no go back.
Just while we're talking about this particular issue and the way these gentlemen are managing this work session, just keep this in mind when we bring forward a governance report. So it has time limits on work session That's not today, but just some of you seem to enjoy it. Some of you seem to enjoy making fun of it. So we'll see where we are. Thank you all for being here today. I'm going to focus my questions a little bit on parents as partners and family engagement. So I'll start at the kind of beginning. One of the things that I really felt we needed when I say we, I meant in my district. So I guess it was kind of a hybrid of a family literacy program. It was the one at Rose Hill Elementary School. No, it was Rose Hill, but at John Marshall Library. John Marshall Library's been under construction. We haven't had that. Explain to me maybe the difference, and maybe to my colleagues, about the differences between that program and family literacy, or is it the same? And I definitely think it's something, I'll just say this up front, we need to expand, because it is the best opportunity for parents as partners, growing them. It grew that Rose Hill PTA like nobody's business.
Well, we certainly agree. And I'd ask Renee to come to the table for a response. She has much greater detailed knowledge of each of the programs and can share with us what that sounds like.
So our family literacy program is in partnership. It's ran out of our ESOL office. Right. So the difference with family literacy and our early literacy and our HIPPY is it's the same model, but it's using a different type of curriculum. And the family literacy, we try to do of a parent leadership model. Right. So when they expand from family literacy, the next step is the parent empowerment and the parent leadership, in which we're trying to build out further with our ESOL office.
And so how many places do you have that located in? I guess I would ask as a next step just to have that report as to where we have it, and by pyramid or whatever. If it's already in there, I'm sorry I didn't.
Yes, I believe it should be in here. Addendum? Yes, but I had to
we can pull that out.
I can pull that.
All right. Well,
and let you know.
That's not quite there. That's not what I want, Ilion. But okay, yes, if we can use that kind of as a next step to see, because I definitely think the model that I was talking about was where the family attended with the child, and then it was like parent-led activities with. I know Micheline was part of that.
Yeah, and our family literacy and HIPPY are the same way.
Okay.
Yeah, we try to spread it out around. To get the different programs in different areas and different community centers.
Right. And so I think the one, though, that was missing in my area, I was never notified if there was a new one in place as a result of John Marshall. So I'd just like to know where they are, because I think there's definite pockets where this can really help. So I'm not sure if you'll stay for this next one. But so then I go to that high school level, and you talk about the immigrant family reunification projects. And I would like to know, it says the Families Reunite is one, and the Parent Project. I would like to know how they're promoted, what are the levels of attendance, are they done in tandem? And those are my three questions as to those two classes and for parents, and how they're interrelated.
Yes, so with our Immigrant Families Reunification Program, that is a 3-week program. And when families finish the Immigrant Families Reunification Program, we move them into Parent Project, in which is a different curriculum, and it's a 13-week, much more intense. And this curriculum tries to deter delinquent behavior. So this is part of the funding that we got from the Board of Supervisors to extend some of that work. And we just had training in 5 pyramids for our parent liaisons to use this as an outreach strategy coming next year, so we can provide more direct and intense outreach to our families.
So it's in the 5 pyramids that are listed. I guess that's on page 8. I had that up. And those are the current ones, or those where it's being, let's see, because it says it's being offered 3-session class was offered at Mount Vernon, Stewart, Annandale, Edison, and Falls Church.
Yes, and that was what we used from a funding from grant that we got from Wells Fargo because we had no funding for this program in our office. So we were using grant funding from Wells Fargo.
Okay.
Moving next year, we're going to be in the Mount Vernon Pyramid. We're going to be in
Annandale, Stewart, Herndon, Mount Vernon, and Falls Church.
Yes.
Okay. So some are the same, but some of them have moved.
Yes.
Okay.
And we're extending it all the way to the elementary level. So it's going to be pyramid. There's another curriculum called Loving Solutions that we'll be doing at the elementary level.
I would love, as next steps, ladies, I would love lots of data point. Like I would like links to these programs. I think these are really important that we understand and we know where they're going to be. So I really appreciate that. And there is on page 21, as everyone had seen, that the addition of the SOSAs and the favorable trends in the areas of discipline. And I will wholeheartedly support my principal from Hayfield Secondary saying we need to expand that. Oh, he's gone. He didn't even get his kudos. But I think that's really important. And then we talk about how restorative justice works. Is there any consideration of expanding the restorative justice programs to the elementary schools?
So we have a plan that we have been developing. The leader of the restorative justice program, Vicki Shope, her husband was in a very, very bad accident a few weeks ago, and she is out until August. But she had already started, and the person who is second to her was in the room, but I think she may have left by now. So we do have a plan at the elementary level. At the elementary level, for multiple reasons, we think a better approach. So at the secondary level, we use it primarily as a disciplinary response.
Okay.
And it is appropriate for certain behaviors, right? So it's not something we're going to do for drugs, for example. We have an AOD seminar for that. So it is for certain behaviors. At the elementary level, rather than trying to get people trained to do specific conferences in response to a discipline, we are planning on taking an approach that's more about restorative practices so that a broad range of teachers, ideally eventually all teachers, would understand the sort of 4 questions of restorative justice that you ask: what harm has been done, who's responsible for the harm, how can we repair the harm, that they could use as part of responsive classroom, that they could use as part of a morning circle, that they could use when a small incident happens in the classroom. We are, again, having to just develop a professional development model so that we can get to everybody. But that is the direction that we're thinking of going with elementary, as opposed to really focusing on these high-intensity, time-consuming conferences that we do at the secondary level.
Right, because we just heard from our elementary school principal, and I think if what you're saying can be so impactful in a responsive classroom in morning circle time, because some children may just never have been taught this. And I think that's so important that if we do it that way, hopefully we will see that is so much part of a caring culture, because
it builds empathy.
It builds empathy. It builds trust, and it also makes other children understand, maybe in that circle time, while not maybe that child is reacting this way because of these circumstances, and I think that would be very important. So when will that happen, Marianne? Like, what's the plan, time plan for that?
We are starting, I will have a plan by probably late August that will have professional development throughout this coming school year. I don't know that we'll get to every elementary school in that plan. They're still trying to develop the best method for delivering that.
And just
we
tell have
me
what you're
currently
calling it again. I'm sorry.
Restorative practices.
Rather than restorative
Right.
practices.
So we currently have 2 specialists and 5 restorative intervention teachers. And the restorative intervention teachers are 1 per region, and they work mostly with the middle and high schools. One of the things that we found is that we train about 30 to 35 people a year to be facilitators. But it takes almost a year to get trained and to be mentored, et cetera. And very often then that person moves on to a different position in which they can't necessarily use that. So it has been difficult. 5 years ago when we started this, it was my plan to have 2 or 3 people at every school trained so that they could do it themselves. We're just not finding that to stick. What is working well is, partnering with schools where the people who work from my office can co-facilitate with someone until they feel comfortable, and then they can go on by themselves. But I just don't see that we have the staffing to do that model at the elementary level. There's just too many schools. So I would hope by the end of next year, we want to have every elementary principal know what restorative justice is. We want to do an orientation with them and get the core information, and then the deeper work we imagine will come the following year. We also are realizing that at the middle and high school level, again, we've had turnover. So we are building into our plan that we have put onto the PL playlist that every secondary administrator, middle and high school administrator needs to have completed the restorative justice orientation so that they know what it is and they know when to refer and ask for somebody to come and do a conference.
All right, thank you.
Thank you, Mr. Woodson.
Thank you, Mr. Moon. Well, initially, I would just like to circle back to a statement that you made that some children haven't heard the word no before they're showing up to school. I mean, I just really want to try to understand, what are we saying about parents that have young children now and they're coming to school? I'm not sure that is clearly expressed in this report. Are we really saying that families are that different now than, say, 5 years ago in terms of what's happening in the homes?
Again, I brought that up as something that I'm seeing in the national literature. I don't have good data on it other than, again, concern about lack of face-to-face social interaction in our youngest children. So I'm not going to place it all in the laps of the parents, but they, from pretty early age, are pretty scheduled into pretty structured situations in which the sort of free play and a startling number of them start with devices at 2 or younger.
Right.
And so it's not, there's a whole body of research on what the device itself may be a problem, but it's also hours not playing. And play is very important to the development that we've seen in children thus far.
Right. So then Ms. Strauss had focused our attention on pages 19 and 20 of the report. And so when I looked again at some of the charts that you have here, in particular the mistreatment of others graph on page 20, really when you just focus on that alone, it is a little bit alarming to see that it's maybe 75% increase in 3 years in high school, maybe 100% increase in middle school in 3 years, and maybe closer to 250% in elementary school. And I guess maybe this is the next step, but I guess as one board member, I'd like to have that unpacked a little bit. Is that because these numbers are relatively low and they're localized in a certain group of schools, or are we talking? It's hard for me to understand what this means when I take it in the context, particularly with the elementary, and you're talking about kids, maybe showing up to school, maybe very different because they're on the screens or something. I just would like, as a next step, if you could provide more breakdown of that data for us and help us to understand what that particularly that graph tells us about what's happening in our schools.
We will look at the data that we have and do that to the best of our ability. I will say that it has not come forward as a localized problem. it seems to be a bit more generalized, but we'll certainly take a look at the data and see what we can parse out.
Okay. I also would like to just follow up on the principal's comment about how the fights seem to be occurring more often with the girls. Maybe you can just talk a little bit more about that. Is that consistent from across the schools, what principals are reporting, or is that just one anecdotal?
I think that was anecdotal information that was shared. Many principals at the high school and middle school level would probably agree with that, but I would say we would really need to go back and look at the data and how we could pull that data in order to really give an accurate statement about that.
Okay, because when I looked on page 39, you deal with the mental health of girls and having it now a rising sophomore girl myself. I know that my wife and I, we focus an awful lot on self-esteem and how she's feeling about herself and in school and her optimism about academics. And I really think that those two things may be related, and I would like to understand that a little more fully as well. And so I don't know if that's the next step, that there's a way to sort of provide us a little more insight into that issue of fights with girls and also tying it to mental health, if there's any way to sort of get at that a little bit.
And I think that particular graph on page 39 just shows how significantly having those assets impacts across all of those behaviors, including stress. So, I mean, look at how significantly stress drops when kids have an adult they can talk to, when they, they're in extracurriculars, when people recognize when they do good work. So there are things that we are looking at through the newer focus on the strategic plan items that will particularly try to build those things that we know, build those things in youth that don't appear to have them, to be sure that every child has somebody that they can talk to, for example.
Okay, and then on page 74, Appendix C talks about the executive functioning intervention. You didn't mention that. I know in years past we've talked in depth about the efforts to promote executive functioning skills. Can you just talk a little bit about
Sure. I put this in the appendix because we didn't really have a metric to measure. And I'm going to ask Mike Bloom to come up here and speak a little bit about our executive functioning interventions that we have and the work that we've been doing.
While Mike's coming up, I mean, just having two boys, I can tell you with my own anecdotal evidence that sort of instruction and just teaching boys to understand themselves about what it means, understanding what executive functioning skills are, and how that impacts your ability to look and think about a project. You know the end point, but understanding how do you take the steps to get there, to get projects done is really crucial, not just for kids that might be on the spectrum, but maybe for a broader range of kids.
So at the elementary level, we've done a number of things to address and build our teachers' knowledge of how they can embed skills of executive functioning within their teaching routines. So in the Office of Special Ed Instruction, we do have professional development that we provide to teachers that teaches 19 very specific teaching routines that can build and help a teacher to, just within the normal course of their teaching, embed and build executive functions. So one good example would be helping with planning and organization around long-term assignments, setting a schedule for studying for tests and quizzes. There are also self-regulation skills, problem-solving skills. So again, equipping teachers just within their normal course of teaching how to promote those skills with their kids. We do have some of the different studies that we've been involved in that are in the report, the research that we've done with Children's National Health System, originally centered around students with autism spectrum disorder, but some of the work that we've done shows that many of the interventions around Unstuck and on Target, which is an elementary intervention, is also good for just kids with deficits in executive functioning, students with ADHD, and many other different groups of kids. So we're expanding the work in our elementary schools to include students not only with autism spectrum disorder, but who are just having deficits in executive functioning. At the middle and high school level, again, the work with Children's National to expand the curriculum work around Flexible Futures, which is the high school study for executive functioning, and On Target for Life, which is the middle school intervention. So we're going to be, as we're allowed to, because the middle and high school programs are not yet published, so we can't disperse to all of our schools, but working with Children's National to at least expand to the schools that we can, and working closely with them so that as they get those studies published, we can have access very quickly to disseminating and getting those programs out to our schools. We also, at the secondary level, have 2 elective courses, Personal Development and Strategies for Success. Personal development is specific for students with disabilities that works on students who have social, emotional, behavioral goals as part of their IEPs. And we can also look at executive functioning and how we can build social skills, executive functions within that elective course for our students with disabilities. But the Strategies for Success elective is open not only to students with disabilities, but to all students within the secondary schools, middle and high school. And we have a very specific curriculum. It's called the Executive Functions Skill Building Program. And we have a curriculum that covers many aspects of executive functioning. It's a structured, explicit curriculum so that teachers can explicitly teach those executive functions to kids who enroll as part of that elective course.
That's fantastic. And have you seen, I mean, we've talked a little bit about screen time with regards to kids showing up to school. Have you seen in the research or that there's a connection between this executive functioning, attention, and the amount of time that kids seem to be increasingly looking at phones and laptops and tablets? Is there a connection there? Because I guess sometimes I hear assertions that things might be connected.
I personally haven't seen any research making that connection or that correlation with screen time.
I would like to add that we are also offering executive functioning courses for parents. And so some of our instructors are in the back of the room, and we'll be rolling more of those out next year.
Okay. Yeah, and I guess I would be interested to know, I because I'm married to an early intervention specialist, and she is often talking to parents about, have your kid put down some of these instant gratification screens that, they get a stimulation every time they click on something, and try to find ways to modify, what they're doing so that for communication purposes in her case. But I think that that's something to keep an eye on, and I guess I would like to make sure we get follow-up from staff on the research and executive functioning and the connection, if there is any, to some of the communications stuff that we're doing with FCPS on.
Yeah, I'm not aware of, but certainly we can do some research. I'm not aware of something that would explicitly say executive functioning, but what you will read in some studies. Again, a lot of this is new, but they're doing imaging studies. They're seeing changes in the brains. They're seeing attention differences, and they're seeing sort of self-regulation differences. But I'd have to go and find the citations. That's just sort of in my general knowledge at this point.
Yeah, right. The last thing, and I was just commenting to my colleague that this report covers so much waterfront. It's very difficult in this work session to sort of to pull in the full spectrum of this. But the last thing I'd like to talk about is the fitness efforts, and maybe this falls into Chase's bailiwick in terms of staff and making sure that the efforts to engage staff to participate in the fitness programs and efforts, because I think that there's a connection even to morale and health just generally, that if we can focus on, I guess because we've all gone to graduations, we've all observed teachers who are very exhausted and tired, and of course that's the normal end of the year. But sometimes when I'm looking at them, I'm thinking, maybe if they were engaged more in physical fitness and with their colleagues, if we could find a way, we might be able to just improve the morale in our schools, and just wanted to find out what we're doing on that front.
Sure, and Dee can expand on this, but we do have a couple of different fitness challenges or wellness challenges that we do throughout the year, and we try to have a variety of different ones because we know that people like to get their fitness in different ways. Admittedly, our team is very small, and so the ability to communicate those and the ability to encourage those efforts is really done by some of our volunteers and our liaisons. But we try to push that out through email and reminders and give, prizes and try to make it fun. Like, I've already forgotten what the walk to Hawaii was called. And it probably wouldn't be a walk to Hawaii in Hawaii, but the Ola Wala walk this spring, and other ways to just let them form teams, to your point, Mr. Wilson, things that they can do as a group to hold each other, accountable is not the best word we want to use when we're talking about, helping each other be healthy, but we are trying to get that out there and do it in a variety of ways. But admittedly, it's also a resource challenge in terms of being able to communicate it as much and as broadly as we'd like at times.
Yeah, and I think this particularly this year, led by, I'm grateful to citizens from Sully District to get the recess effort galvanized and get legislation passed, and we're adopting, some changes to our recess policy that's related to the acknowledgement, and I think parents knowing that these children need to move, they need to be physically active, and I think the same is true really for our staff and adults and people of all ages. So I think I would just encourage us on staff to not let that just be something that adults can just take care of on their own. Let's continue to try to encourage that, because I think it could make a big difference.
Okay, thank you. I know I have 1, 2, 3, 4 go backs, but I do have a few questions to ask myself. The discipline entry data and overall behaviors, trends thereof, my understanding based upon your presentation is that high school, the behavior seems to have improved, not necessarily for the middle schoolers. Is that correct? But my question to you is not just within Fairfax, but how are we compared to rest of the Commonwealth, other school districts in Washington metropolitan area, or with the national data, whether there are such a data that.
Thank you for sending the question ahead of time. I was able to look at surrounding areas. So if you just look at number of offenses, these are all Virginia schools, so number of offenses sent to the state of the offenses that occurred in their school systems, Fairfax County had about 4.3 per 100 students. 2 divisions near us were lower. Arlington was 1.9. Loudoun was 2.0. Alexandria was 4.9. Prince William, 8.2. Virginia Beach, 14. And Norfolk was 33.9 per 100. And the state average in Virginia was 12.7. So ours was 4.3 in terms of just entries, not what happened to you based on that entry, but entries. We are in the lower end. The 2, Loudoun is lower and Arlington is lower.
Okay, thank you. That was the first question. Second one has to do with some of those wonderful programs, the HIPPY and early literacy. I sent in my question yesterday, so you know where I'm coming from, whether those programs are also available in the evening hours or on weekends for those who may not be able to get there on weekdays during the day.
We try to accommodate the family schedule to the greatest degree possible. And so we do have our instructors who are meeting with families in the evening and on weekends. Yes.
Okay, thank you. You think you can give me a little more concrete data on that?
Sure, I can do that. Yes.
Okay, thank you, appreciate it. The next one has to do with on page 18 of the presentation. You did not present, but I'm talking about slide presentation. There was one particular number of employees trained, 14,125. Is that 1 year data or is it multi-year data?
That's multi-year
That's
data.
multi-year
So it's
data.
now over 15,000 employees, and we're talking about cultural proficiency modules.
Over how long period of time?
Nina, how long is that data representative?
So that data is for the Module 2 training that has been countywide this year.
Just this year, so 1 year data.
Yes.
That's what Nina says, and she's correct.
That's a pretty high number. So yeah, my gratitude and my congratulations to you. And just a couple more quick questions. The recidivism data on page 15 of the report, that 10% recidivism is for those on restorative justice and discipline circle. Do you have any similar data for those not on the circle?
I don't. We can do an analysis of that,
If
but
you could.
I don't have it right.
And so long
at
as
my
that does not
fingertips.
take too much of your time, I just want to be able to see how that's compared. And the one last question is, I guess, use of devices, the number of hours, more than 5 hours or so, by our students. And I mean, I assume that that is taking place outside the school setting, correct?
The question asks not for school purposes, so it could theoretically include lunchtime or whatever, but yes,
Okay,
for the
lunch
most
time
part,
is
it's
limited. Most
outside
part
of-
it's
for the most
outside,
time, it's
which
outside.
is pretty unhealthy when you do that for more than 5 hours. It's very unhealthy. Maybe I'm guilty of doing that myself. But so what could we do to reduce that?
Again, I think that as we've looked at the asset building and how do we communicate that, this is another area where we just feel that parents are begging for advice on what to do about the devices. They're not sure how much to limit them. They're not sure how young kids should be able to have them. They're not sure how do you say no when the kid is going to throw a temper tantrum or sneak it if you take it away from them, because the situation has been set up that the kids expect to have them at all times. And so primarily we've been working with our community partners in neighborhood and community services and a variety of other settings to see if we can come up with a message that could be shared at teen centers, at rec programs, at various groups that have interactions with parents, as well as communication out through, we now have a Healthy Minds, is that what it's called, Dee Dee? A Healthy Minds blog that has a variety of topics that are sort of mental health focused. And we put things on that and they stay on that, but we've also worked with our communications office to take pieces and put them out as Twitter, like just small pieces of information. Here's a piece of information that parents could get in just a snapshot about activities that you could do besides having your kid on a screen. I have a lot of anecdotal information, but there is a whole lot of research going on in this area right now, and we're just trying to pick up what the best practices are and then communicate with parents so that they're aware. I just don't think parents at this moment are sure, because their 10-year-old is saying, but everybody has an iPhone. And yes, well, everybody used to say, but everybody's mom is letting me go to the dance, right? So, but
I think the parents are asking for really begging for help.
Yes.
I mean, I've been hearing from myself from parents. They, as you said, they don't know what to do. And I think we are working with community and parents got to come up with ways to mitigate this, because this is not just physically unhealthy, but overall stress level and other that affecting the future of the youngsters are just, to me, it was mind-boggling. So with that done, we have exhausted our 2 hours, but since there are 4 members on the go back, let's see whether we can do this, wrap it up in about 10 minutes. I know that Mrs. McLaughlin probably deserves more time than others based upon her efforts to limit in the first round. So Mrs. McLaughlin to be followed by Mrs. Schultz and Karen Gamara and Ms. Belchick. And Ms. Evans.
Well, just quickly, I think maybe we'll be doing this in part 2 where we're talking about the employee engagement survey. Or are we not doing that? Because it's just as a FYI, it's
part 2
in your
was
packet.
inside the 2 hours.
Okay.
So.
All right. Well, I think I don't know where our chair stepped away. I would say it's late, but I do not think we can shortchange the employee engagement survey. That is something that the board looks forward to every year, reviewing. I think we're making some good progress. So I would just humbly suggest, since you're meeting manager, that we should just tack that on to whatever, give it an hour, but we need an hour at another point in time. I don't want to see that going away. And certainly this wasn't presented as we're going to cover all of the goal to report.
Okay, so Mrs. McLaughlin, as the next step, we'll see what the board is on that request, and we'll go from there. I don't make the decision myself.
That's okay. I'm gonna forewarn everybody. I'm going to put a lot of guilt on you if you don't want to be talking about your employee engagement survey. Yeah. Good old Irish Catholic. I'm going to really lay it on thick. So the reason I mentioned is because there's a section in this report, but I do want to draw people's attention to it, and it's on page 33 of the report when it talked about the engagement survey results. And what it said is where 49% of division administrators and 57% of school administrators are highly engaged in their work. That's compared with 31% for support staff members and 30% of our certified staff members. So I do think that's going to be something that as a board member, as a next step, I'm going to want to better understand why are we seeing that differentiation and how people feel about their work. In terms of a glow, I do want to also say that it is fantastic to see that our employees participating in this survey went up 10 percentage points to having 75% of our employees participate this year. So to Dr. Brabrand and Chase and all, that's a fantastic statistic. Having been on the board, I know there were times when employees were uncomfortable and even expressed that they were a little bit fearful to participate. I also wanted to just take note, because I know there's been a lot of people talking about it, but I still would like a deeper dive at another point in time. When you look at the significant drop, and this was under the SOSA section on page 19, disruptive behaviors, the number of entries. I mean, when you look at in 2013, 14, all the way down to 16, 17, there's a drop from 29,000 entries when we were from 4 years prior to down to 15,900. I mean, that's significant for being able to say, how are we responding differently? I mean, you're cutting that number in half for our high school kids. I did want to ask just a little bit of clarity, because it's in so much of this report. What was the rationale for giving us data charts that were broken out by month, as opposed to just giving us year to year? Because
in the appendix or in some other section, because I know the restorative justice was broken out a little bit, but Ms. Schultz and I had a conversation, and I did want to provide some information to her that she had asked me about. So that's part of why.
In the appendix, it's in the body of the report, like page 15. And I wrote it in a couple of spots where I just kept saying, why are we just getting this monthly numbers versus the yearly? Like the growth in the number of restorative.
I'm happy to answer, because this is something I've been on for a lot, and staff can do another. But as we trend towards quarter ends, as we look at returning from school at the end of the summer, if we look at what happens after a spring break, I think it's important for us to understand, is it steady through the course of an academic year? Are there periods that we can trend towards supports in an anticipatory way? So that's kind of the conversation that I've been having with staff over time, so that we can direct our resources so we become proactive instead of reactive. So I don't know if you have anything else to add, but those are kind of things that I think will help us.
I think that's fine for maybe drilling down a little bit, but I think there needs to be a macro level chart that's one up more that to the one I was just showing on disruptive behaviors, which is a great chart, and it shows you in totality, here's what happened in 2013-14, here's what was happening each year up to 2016-17. It really gives you an ability to see what's the trending year over year. So I would like to see that. And I also wanted to do a glow and a shout out to the military program that was cited in here. I'm trying to find the exact page. I tried to. Our military connected youth, the process action team.
Page 9.
Yeah, page 9. I thought that it was really great to hear that this is being recognized.
I'd like to recognize Dr. Baylor has really been leading an entire team, and that team has been extremely focused and they produced a lot. That's a team that meets, and at the end of each meeting, they have a product and they are moving forward.
Yeah, so well done. Yeah. So that's just excellent. The one thing I would say is under analysis, I was just curious, did we think to survey our families? Oh, sorry, page 9 and 10 of the report. So under the military connected youth, there was some analysis there. And so there was some anecdotal information provided, but I was just wondering if for next steps, would we consider, when saying seeking input from youth and families, have we thought about being able to survey those who participate in that military connected youth and process action team, like just those who we're trying to reach, surveying them at the end of the year to kind of say, okay, what was it you drew from this program? What can we continue to move on? I just thought here you have a really great community that by surveying them, we would just be able to know what was meaningful to them.
We can certainly explore that and talk to our school liaisons at Belvoir.
And one of the things we did do was we added a question on the youth survey that asked if they were military connected. So we've been able to do some more analysis of, as well as on our registration, so that we've been able to do a little bit more analysis.
And one final thing, as you know, what a proponent I've been of our restorative justice, and I'm so proud of our county partnering with us, with the juvenile court system, to get us going in that direction. But I don't know if you all can answer, if Dr. Braybrand can answer, but is the hearings office, have they gone through restorative justice training? Because I have a recent discipline case where the AAP would have been absolutely perfect, and that did not transpire. And the case ended up where the court system diverted the individual student, but not how it happened in our side of things. And I'm just worried.
The hearings office, at least Dana and 2 or 3 of the hearings officers have gone through the training. They don't make the decision, however, about what comes to them. So that would be a decision that would be made at the principal level.
That's actually not how I understand how things happen, Marianne. What I understand is the principals will call and get guidance from the hearings office about how to handle things. So
in certain cases, yes, and then
Right.
there are certain things that are mandatory to them. But at the end of the day, what we have been trying to do with the SROs is, depending on what the situation is, of course, if it's not something that's mandatory to go to the hearings office, then the AAP approach works for both the discipline and the possible criminal case.
Yeah. Well, I appreciate that. And Dr. Braybrand, I will just say that it's going to be my next step for today as well. I think it's imperative that, to my knowledge, that yes, our principals do still very much when it's in question, we'll confer with the hearings office. And I think if we're all as a system on the same page, then I would be very encouraged to see every one of our hearings officers getting that restorative justice training, and that we will continue then to see those kinds of outcomes, because
we're also trying, now that we have a few years of data, we are planning on providing, as I said, we're going to sort of do a refresher training for secondary administrators. And in that, we plan to provide a list of violations that are most responsive to a restorative justice intervention, because not everything is. So to sort of give them guidance, which we had not done previously, to say, you know, if it's this kind of case, this kind of case, this kind of case, then we suggest that you consider restorative justice. Now, again, there's going to be a lot of background information that we may not know, but at least that sets up more consistency across the schools about what types of behaviors might be referred to restorative justice.
Well, I appreciate what you just said there, but I'm going to still gently push back at a macro level that this system is making great strides on a tiered approach to discipline, but I really look forward to us continuing to do that. I think we should be looking at very limited cases that have got to go to a hearings office, whether it's because of law, but where and how we can divert, and I think restorative justice and in-school suspensions are crucial. And I again, offline, Dr. Braybrand, this summer, I've told you, I'm going to want to really get a better handle on where have we had opportunities where the court system, we know they diverted and we weren't, because we're the educational system. And if they're diverting at the court side of things and we're not, then I think we're missing something. So, but my glow is that I know we're making progress, and I appreciate everybody's work in this arena.
Okay, the 10 additional minutes expired 2 minutes ago. So with that in mind, Mr. Schultz.
Just a couple things on the stress. While we were talking, and I've sent it to Dr. Braybrand, a pretty significant article has come out in the Washington Post that the 8 top elite schools in our area, like Sidwell Friends, have eliminated AP courses. So hopefully that'll be in our news clips, and that will be something interesting for us to read and understand. The other thing that, and maybe some of my colleagues have been getting to it about the self-regulation piece and the executive function piece. These are pieces that I've been talking about for a long time. I am concerned. I maintain my concern. And if we don't have the information that shows that regulation issues are impeded by studies with screen time, then we need to get a hold of that information. That becomes imperative, and that goes right back to my request to get somebody from the Center for Humane Technology to have a roundtable discussion. I'm going to renew that request for about the 14th time. But I also sent from the Thomas Fordham Institute a little while ago, Dr. Braybrand, to you and to you, Dr. Johnson, Mrs. Johnson, something that was done on a nationwide survey on data on self-regulation, and they compared public school data with Catholic school discipline reports. And unfortunately, a really substantial difference. And it was around self-discipline, discipline that came from within, as opposed to all of these structures, which are sort of supports and external discipline. So looking at the data that exists out there as real information that can help inform us in terms of policy development, I think becomes essential. And we can't just add more personnel always. Sometimes it may mean that we need to look for those expert reports that are out there. So I encourage staff to continue to do that as we move forward. That was short.
Okay, I have Ms. Keys Gamara, Ms. Pelchik, and Ms. Evans.
Yes. I wanted to follow up on Ms. McLaughlin with respect to the restorative justice. And I'm not sure if we have considered it or whether it will be a part of the new structure that we're adding, but I would love to see schools be able to get advice when they're dealing with these kids in terms of providing behavioral guidance and how to perhaps suggest executive functioning or whatever it might be, or a behavior intervention plan. Because if they are seeking advice, I'm not sure that the hearings office would really be the best position. So I just kind of suggest that as a possibility, or is that something that you've thought about already? And let me finish because he's going to stop me from talking. So the other thing is, hold on a second. The other thing is this is an excellent report, but I didn't see anything regarding how we're dealing with homeless children. And I have had occasion to come in contact with FCPS employees who are dealing with the homeless and talking about the difficulty of how that is balanced with county employees. And so certainly would like to see something on that. And then the last thing, I think you mentioned courses for parents. And I would like for us to consider the possibility of how we're utilizing those. Parents can't always come to the classroom. Can we have videos for them, or what other options might we have to reach out to those folks that we might not otherwise be able to serve? Okay, that's it. Thank you.
I just want to respond to let you know we get many, many calls from schools, principals, assistant principals, counselors, and instructional services, as well as Department of Special Services, asking for assistance and advice.
Okay, I have a...
Can I respond to the parent courses? So we have a parent resource center. We had over 3,000 parents participate in workshops and classes. In addition, we're gathering data from all of our schools around the courses that they offer within their school settings for parents. So there is a whole host of programming for parents, and we're going to pull that data together.
Right. If I could have a next step for that, 3,000 is awesome, but we've got, 180-something thousand kids. So I'm just hoping that we can look into ways where we can't maybe not physically touch a person, but we can make that information available to those who might be able to benefit.
Regarding the homeless, we do have a report each year. It may be most efficient if we wanted to set up an appointment, and I can have our homeless liaison go through. That's good.
Okay, I have a Ms. Pelchik to be followed by Ms. Evans.
Just two very quick points. Number one, I second Ms. Keys-Gamara's request to find ways to in-person or not in-person meet parents where they are in their time schedule. I know it's harder and harder, especially parents working 2 or 3 jobs. So anything we can do, I would highly support that, and especially through other community leaders. And then my other one is quickly, as we were discussing, I had my little teacher hat coming on as we're hearing about social emotional curriculum and executive functioning curriculum. Because I'm wondering, as a teacher, we're always like, give me more time, stop taking my time away. Do we have either, elementary, middle school, high school areas where kids aren't registered for that specific course? Any cross-curricular, whether it's incorporating that curriculum into language arts curriculum or other ways to help reach kids and not feel like you're giving up part of your curriculum to do that?
So I can only talk to the social emotional piece, but the elementary program, as I said, a piece of it is helping the teacher's emotional state, if you will. The child curriculum is entirely embedded. So other than teaching the kids some vocabulary that expands their emotional vocabulary beyond happy, sad, mad, they also learn to sort of recognize in themselves when they're feeling certain ways. But most of the lessons, if you will, are if you're already reading a book. How did this person act? How did this person react? How do you think they were feeling? Those kinds of lessons. And so it's like a framework almost that you can use to embed in social studies and in English very easily.
Okay. And that's only Currently in the elementary level.
That's the elementary ruler program. At the middle, we don't have currently a middle program. At the high school level, there is using but universally using the intervention time. We have 5 high schools right now, and they're sort of rearranging their schedules to their master schedule to make sure that they have time for this. But it's basically putting in what we might have called an advisory period a certain number of times, and everyone would go through the lessons over the course of the year. So it's not pulled out by, a particular subject area or something. It's built into the schedule. Ultimately, once a given school has been exposed, in the future, then it becomes like a freshman experience.
And currently, so at the middle school level, it's only students enrolled in those 2 courses that were meant for executive function.
Executive functioning part.
Yeah, so I'll just add that also at the secondary level, we have had an academy course based on Mountain View Alternative High School's model for how they equip their teachers to embed, again, throughout their core content, the skills of executive functioning. And so we've had probably the last 4 years run that academy course where either as a team or individual teachers can come and they can learn how, again, within core content, how they can stress the importance of building executive skills related to making sure that you're studying for tests and quizzes. Again, that's just one example. What's the importance of that, and how does that factor into how you can become a successful student? Time management, materials management, all of those organizational pieces of instruction. But again, having the teacher not just assume that kids have those skills that they need, but as you walk through a long-term assignment, you're actually talking to the kids about the importance of having that skill and being able to demonstrate that skill. And then at the elementary level, school counseling services, the last couple of years have developed a number of lessons for elementary school teachers all around executive functioning. And so those are right now in eCart and available to all elementary school teachers. And so I know that a number of teachers, again, will very systematically go through those lessons, and they're designed to be very quick, 10, 15, 20-minute lessons that they can go through with their kids on a daily basis to build executive function skills. So those are additional ways outside of elective courses or a tier 2 or tier 3 intervention for smaller targeted groups of kids that all teachers can really look to embed those skills of executive functioning within all of their kids.
Okay, thank you. I have Ms. Evans as the last one.
Thank you. I'll try to go quickly. I'm going to agree with my colleagues who have talked about the screen time issue. I think that's something we are going to have to grapple with. And as a next step, I would appreciate getting the breakdown of the number of hours of screen time. I think that would, I know you said 48% have 3+ hours a night. I think it would be good to see, how many have 4, how many have 5 hours. So I'd appreciate that. Something we haven't discussed is on page 8, the number of people who talked about an unwelcoming environment, and that's unfortunate. I will say I have heard from a number of parents recently a continuing concern about if they advocate strongly for their child, they worry that it's going to come back around on their child, and no parent should have to worry about that if they that if they are advocating for what they believe their child needs, that they feel rightly or wrongly that the principal is going to be mad at them, the teacher is going to be mad at them. So I do think that's an area that we need to work on. It's page 8 of the full report that there was a recognition of that. I also will say, my last comment about the report, I think it's an excellent report. You have a huge amount of territory to cover here, just a huge amount of territory. I particularly appreciate the significant work on the mental wellness. Our students keep coming back to us time and time again, talking about mental health and stress as an issue of great concern. So that is great in there. I will say, because this is, I believe, the only health report we get, that in the future I would hope to see more on some of our basic health measures like nutrition, physical activity. I mean, nutrition and physical activity were mentioned here, but with the exception of recess, we really didn't talk a lot about how much physical activity the kids get, and I think that that's again going to be increasingly important. You've got physical activity, nutrition, and sleep as the basics. So, just for the future, I would hope that we would focus on that more, because I believe this is the only report in which we really look at that, and it's fundamental. So, thank you again.
I would just, and I don't want to step on.
To get any.
I don't want to step on Teresa's toes, but I mean, I did sit here quietly. So, but to Ms. Evans' point, I appreciate that feedback, especially about those metrics. But I think, again, that goes back to the strategic plan and really how we report out on that. And so I think some of those things are a product of some of the pieces that really aren't captured necessarily at the forefront in the strategic plan. And so it's difficult sometimes to bring things and just continue to bring them and not know where that path is. I'm not saying those aren't important. I think we do believe those basics are important, but it's kind of as we focus our efforts and really trying to have that laser focus on those different pieces inside the strategic plan. So.
And I will agree with that, which is why I feel so strongly about our strategic plan being more forceful in this area, because I think it is so important. And rather than looking at healthy life choices, we need to look at our responsibility on that. That is partly why that is my advocacy.
Mr. Moon, do you want me to take 60 seconds to try to cover some of the...
Sure, please.
So, and I agree with Ms. McLaughlin. I do not want to shortchange this. I think that our employee engagement is extremely important. I'd like to point out part of our team. Craig and Shelley are sitting behind Dr. Brabrand, and they've been here, and they are instrumental in the work we do around employee engagement. And in fact, that team is also instrumental in the work we do around honoring our staff, and so I think they did a great job with honors a couple weeks ago, and I'm glad to tell them thank you for that. But in terms of employee engagement, really the executive summary on page 2, I think, hits some of the highlights, and so I would just draw the board's attention to that. I won't go over them. I think this is a good story, as Ms. McLaughlin pointed out, about the increased participation. And while our engagement is about 84% that are engaged or highly engaged, it's been pretty flat from last year. And so I think the other piece that's ripe for the discussion is, as we talk about today, caring culture and looking at really that climate, and is this getting us to where we want to go on that, and what we're trying to measure. But I would just leave the board with looking at the executive summary, and we can come back and have some additional conversation. But I think it gives a good flavor for where we are and sets the stage for what we might want to do next in this area. Thank you.
Okay, thank you. With that, we'll go to next steps. So number one, Mr. Schultz, does that capture your request?
Yes.
Okay. We'll do one by one. Those in favor, raise your hand. Okay, thank you. Mrs. McLaughlin, would you take a look at your second one?
Were you talking about, like, compared to past years? Oops.
I'm looking at number 2. I mean, I remember.
This was about year-to-year comparisons on certain data on certain pages where we could provide the year-to-year.
It wasn't just about the youth survey.
It was throughout the goal to report.
It was throughout the whole goal to report, where we would have percentages. We should have the actual numbers provided.
Right. So was this just more feedback for us moving forward in the future?
No, I'd like to see those numbers
Or
of
this year's?
this year's report.
Well,
Like in other words, you've produced the percentages, so you must know the actual numbers.
Why don't we do it this way? How about, you said provide context for a youth survey. How about they offline with you? We can get further feedback on, I doubt we would do every graph.
Honestly doesn't, I said a couple of things. One was, I was talking about the fact that we had the information on the youth suicide review team and pointed that out. But when I said context of numbers to percentages, a lot of it was the student discipline stuff that was up there, where we just kept getting percentage, but it didn't have the numbers. And so I said, you can't know, like,
and I'm going to support this, because this is something, again, this is a standard, so this is a best practice of just, if we get a percentage, we should get a raw number that goes with it. If we get a raw number, we should get a percentage that goes with it. That's the full context of any staff presentation of data.
So Mrs. McLaughlin, for this next step, could you tell us exactly what you are looking for? What would you need? Would you need them to redo the whole report? Would you need them to provide addendum, or would you need those numbers to be included in superintendent's used to be Friday memo, not anymore. BB. How would you want to have those?
Thank you. I first need the youth survey removed, because it's not the youth survey. It's provide context for the percentages.
How about, where practicable, include both numbers and percentages and graphs in the Goal 2 report?
Yep.
Do you think you can provide that as a part of your PB, or how would you like to do that?
I don't know yet. I'd rather include it in the report so it could be embedded throughout, but let me...
Yeah, so Mr. Moon, my request in this isn't because Megan McLaughlin's personally curious. This is an annual report. The public's going to read it. We should have that in there.
So because since we are...
If it's timing-wise, I would just say, we can still all vote on it.
Okay.
But it should be done and put into this report, because this is going to go online.
I understand.
And even if it takes staff an extra month to do it.
Can I just ask one clarifying question?
Yeah.
So for surveys, the percentages are of the kids who took the survey, right? So it's not the same as, like, in a discipline thing, I can tell you exactly how many kids that is. For the youth survey, or for the climate survey, or for any of the rest of the surveys.
The numbers would be the number who took the survey and the number who answered the question.
All I'm saying is I'd have to go back and calculate that, because these numbers are provided by the vendor as percentages.
Yeah, thank you, Marianne. I like how Dr. Brabrand put it, we're practicable. So if it's our numbers, we've got them, you can provide them, that's fantastic.
Okay, and as long as we understand that, this doesn't have to be done by the time
That's
we vote.
right, by the vote, exactly.
We only have 10
and I don't know
days.
if it's going to be on there, but my other one had been that also the graphs need to not just be a month-to-month thing, that should just been year to year.
Okay, so that's number one. So let's see with a show of a hand. Number two, if you support that, okay. Number three is Keith Gamara.
I think it probably should say, examine ways to disseminate information to parents regarding the impact of stress. And this was particularly with respect to, it was less sleep, lower, but there was no correlation to more screen time, and their grades did not improve with, this is in relation to that particular statement. Just FYI. It was sleep. It had to do with sleep, and there was no correlation in terms of. Correct.
Okay. All those in favor of number three, raise your hand, please.
Well, hang on a second. If this is in relation to sleep, then I would ask that we also disseminate information on the impact of sleep on all these other important areas. Lack of sleep impacts so many different things. So we shouldn't just talk about just grades.
In this particular report.
Well, so were other things about the impact of the relationship between sleep and positive impacts of getting more sleep.
I'm referring to a specific sentence. I'm not sure what
I just think if we're going to give parents information about sleep, it should be complete information.
I understand that, but based on what we had today, did you see it? What other connections were made?
I've just closed my laptop, but
Well, how about we put
Dr.
in there-
Panarelli just talked about the impact of sleep on all these various risk factors and how they're so.
Right, but my concern was we were talking about the level of stress that we believe is being produced by the culture, right? And sometimes I think your message, the more you put in your message, the less of a message you have. And so I think that the parents need to know, and the kids need to know, that not getting enough sleep, staying up all night, taking all these classes, whatever that might be, it is not increasing their level of success. So however, it doesn't get you better grades. And so I just don't want that information from what I read to be lost.
So I think maybe we need to reword that to say that, because that reads differently.
Well, I know.
Can I ask you a quick question? Are you looking for a snapshot of information that could be tweeted out by FCPS?
I like the way you think.
Got it.
Yes.
So regarding lack of sleep not leading to better grades?
Right. I can leave it to them. I think they get what I'm
I think
saying.
they understood. They
All right.
understand. Okay.
Okay. All right.
Those in favor, raise your hand, please. So we got 10 more to go, so let's see whether we can go down expeditiously as
All right,
possible.
I'll be quick on mine. I think it should read a plan for proactive support and training for middle schools that could include SOSAs, responsive classroom, et cetera. Doesn't have to be 3 to 5.
But how do we know that, first of all, that that's an accurate time frame?
No,
to
I
work
didn't want
towards?
3 to 5 year plan.
Okay, and then
Take it out, just a plan.
and
or
then
a recommended
I don't
plan.
know that, like, that presumes the outcome of the SOSAs for middle school.
No, it says it could include. It's not presuming that. I'm happy to take it out. I just know that that's something we've discussed, and that's been found to be helpful, so.
You were responding to, somebody came up and testified with respect
We
to
had
the impact of SOSA specifically within middle schools. Remember, he said he didn't want to get in trouble with Dr. Braybrand.
He said they're mostly used in 8th and 9th grade at the secondary school level, so.
But I don't, okay. But is behavior management at middle school what we need? Like, I would rather staff tell us what they think they
And
need.
behavior management is not my wording either, that's fine.
Okay, may I suggest this?
Yeah.
Since we are doing each board member's next step, let's honor the particular board member's language and see whether we can support or not support.
Thank you.
All right?
So provide a plan. Provide a plan for proactive support and training. Marian, what do we call that? Around for students, for student behavior. Doesn't have to take out management, which could include SOSAs and responsive classroom in the middle schools. With the budget.
Okay, those in favor of this, raise your hand. Okay, moving on to number 5. With the Tammy gone, Ms. Kizgamara.
That was a Tammy.
Tammy
Tammy asked me to make sure this was on there, and so I think that's
Okay, with that, those who can support, raise your hand, just providing information.
and the intent would be in a Braybrand briefing or something
Okay,
like that.
thank you. We'll go to number 6. Provide information.
Can I clarify for hers if we know, for parent courses, that included the family literacy courses that are parent-child as well? Okay, thank you.
Provide the information about.
Tammy's got the next 2.
Okay.
Well, I think they're the same, yeah.
Mm-hmm.
Okay, number 6. Number 6, those in.
No.
That's fine.
Right. So
It's a different program.
with the reunification stuff.
Provide more information on parent courses and immigration family reunions reunification program. Yeah.
Okay, with the revising the language number 5, those who can support it, raise your hand, please. 1, 2, 3, 4, 5. Okay, thank you. Now, number 6 is Mr. Fairfax, provide information possible.
I felt like Marianne addressed that, but if she didn't, maybe I could talk to Tammy what additional details she's looking for.
Yeah.
Okay, would you do that? Yes, please.
So, I mean, that can,
Okay.
you can delete that one.
So that delete number 6.
I mean,
you can delete number 6. And numbers, now number 6 is breakout data on chart. Okay?
What kind of breakout data, Tom?
This is the elementary school. I think it is, I can't remember what it was called. It was maybe inappropriate contact.
Treatment of others, right?
Mistreatment of other data. And I just wanted to understand how we had such dramatic jumps and whether we could see where it was coming from within, maybe hot zones in the county or something. It just seemed like.
Right.
Okay, raise your hand if you can support that. Thank you. And number 7 is another breakout data.
Yeah, and this one again, I don't know how the best way to provide this a little more information, but it was mentioned that we're seeing that actually fights are
Growing.
occurring more often with girls. I'd like to
Is that
understand.
data available?
By female? We're just chatting. Is that,
Yeah.
wait, can we pull that data? I'm looking at Mary
Let's
Beth
just do
back
another one of
there.
these where we'll review it, whatever we can, where practicable, we'll share. If there's something that can't
All right.
provide it, we'll come back
Okay,
to you.
number 7, okay. Those who can support that? Okay, thank you. Number 8 was my request, that recidivism data. Okay, those who can support it, raise your hand. Okay, number 9 could be deleted. I didn't ask that question today. Number 9, add employee engagement survey results to future work session agenda. Okay, chairman's gone.
We're practicable.
Uh-oh.
I'll support it if she says we can do it. Let's keep it moving.
Okay, so,
So I know that the chair and vice chair are gone.
Right.
But all
okay,
the-
let's just vote on this and
all
give
the
them,
more
give them
reason
the, yeah.
we just
Give them the task.
Yeah.
All right, let's raise your hand.
We're at
Number
number
9,
nine,
number 9.
adding it to a future work
Okay.
session.
All right, we'll do. Okay, and then number 10. Who got number 10? Include chart showing.
No, that's not what I.
Megan, I think.
It was broken up by month.
Yeah, because she asked for some certain information.
Yeah.
I don't think disruptive behavior is broken out.
I thought we did it across time.
I referenced that disruptive data you actually had the way.
You wanted
Oh,
it,
that you
right?
wanted it
That
that
you
way.
said that's the way you wanted it.
Disruptive data chart where you do it. Use the disruptive data chart as the template for the other restorative justice data points so that we've got the year over year, not it broken up by months. Thank you.
Okay, not.
As a yeah. Year over year. That makes sense to staff.
Okay.
Okay.
Those in support, raise your hand. Okay, number 11.
Turn into Dee Dee. Is this even possible? You've got to come to a mic.
We actually spent quite a bit of time trying to develop a survey for parents and families. Our question was how we would get it to the parents and families, whether we would do it at registration or send it to schools. And we kind of tabled it until next year. So we can certainly revisit.
So the wording is consider, and it's just saying,
Okay.
when working with that
Okay, number 11, those in favor, considering it. Okay, number 12, hearings officer, principals, complete restoration.
Those are already scheduled.
You know, I don't have the status on who has what for training. Do you have that?
I do have who went through the orientation. I do have who went through the orientation training in terms of I could tell you who from the hearings office went through the orientation training. As I said, there's a whole plan for principals and other administrators.
How about develop a plan for hearing officers and principals to complete restorative justice training?
Okay, we already have.
Are you okay with that?
As long as the plan includes they're getting that training.
Well, and my question is this just, there's several levels, correct? So I don't know if we're
So
looking at
this is the orientation level, because
orientation.
there'd be no reason for them to get the facilitator training.
Megan, is the goal to make sure that we have a focus on improving and expanding restorative justice?
Yeah, and so I don't think I mentioned principals because that's already, I would take that off. I just said, I thought it would be valuable and important for the hearings office to have the restorative justice orientation because there is an intersection between what we're trying to do at the school building level and.
Okay, so let's see whether we can support this.
Well, I have one other question, just because you're developing a plan, not just for hearings officer, but any person that could contribute to making sure the restorative justice is more widely used. Is that what you're trying to do, or is that a different lane?
Yeah, I think that's different. This is just sort of our principals are being trained in restorative justice practice. They haven't necessarily across the hearings office done that. And I think as we're moving in that direction as a system, it would help for them to have that training.
All right, I think we already voted on that one. Let's go to the next one, 13. Provide the information how FCPS address needs. Okay? Okay. Is that 13? Raise your hand. Number 14, breakdown of number of hours of screen time reported. Okay, we can support that.
Okay, can we back up 1 second here? Provide information on how FCPS addresses needs of homeless children. That's a pretty broad question. So do you just want a copy of the report that year-end report?
Yes.
Yeah, I thought you were going to meet separately so that could come off of it, but everybody raised their hand, so I wasn't sure if everybody wanted the information, so I just want to be clear.
If she's going to get the information, I want it.
Yeah. Okay,
Whatever
there you go, Mr.
Whatever you
Moon.
send to one board member, you
Okay.
send to all.
And the last question, your breakdown number.
But Teresa, just so we don't get confusion, how about a copy of the report to everybody? I can
Copy
put in
of
the
the report to
BB.
everybody.
You can one-on-one with Karen though, and any other board member after they see the report who wants to get context, flavor, whatever.
Is there a problem?
So, Madam Clerk, if you could put it back. Okay, thank you. So, number 14, breakdown of number of hours of screen time. Those in support, raise your hand. Okay, Madam Clerk, is that the last one? I think there was one missing, number 15, is I think I asked you about, evening and weekend availability of the programs on page number 20, right? Correct? HIPPY and other early literacy. Programs on page, was it on 20?
And I assume we want those geographically?
I just wanted to know, whether they were available.
Language and geographic.
I think those are number 20, page number 20, okay. With that, this work session is adjourned. We've done well.